As previously indicated, the performance measures of the National Drug Master Plan, we're talking here about the 7 goals of the National Drug Master Plan, which I'll refer to, but these have been previously indicated by them in the video, but also by the chairperson. And then 5 outcomes of the medium-term strategic framework of the National Development Plan, and then key activities that are specific to and contribute to one or more outcomes. For instance, in outcome 1, I will discuss the outcomes just now. In outcome, there are social activities that are meant to contribute to outcome 3, health activities to outcome 2, human rights activities to outcome 3, developmental activities contributing to 1, 2, and 4 outcomes. And then security activities. I haven't gone into detail in relation to this because I think this is something that you can look at on your own. It is in the National Drug Master Plan, and it has been used effectively to measure the performance of all the stakeholders that are supposed to report in relation to the National Drug Master Plan. These are the goals of the National Drug Master Plan that we have to report against. I'm not going to go through them again, but I would just like us to keep them in mind, because you'll see how departments will be reporting on this. And then the outcomes and target populations. The medium-term strategic framework also gives outcomes, reduce poverty, outcome 2, reduce level of inequalities, reduce social ills, improve well-being, and so on. And then outcome 4 is empowered and resilient individuals, families, and sustainable community. With that, the MSTF also identifies target populations that all of us must concentrate on when we do our work. Youth and in and out of school, children, women, persons with disabilities, pregnant women, families in all their manifestations include child-headed families, disadvantaged people in vulnerable communities, and occupational groups such as performing artists, musicians, professionals, for instance. I don't think research was done to indicate that actually medical doctors are a group at risk because they are exposed to these substances and sometimes they do abuse them. And then also key populations that have been identified here and priorities then given to these populations. And these are people who use or inject drugs, female sex workers, men who have sex with men, youth and inmates, offenders that are in correctional facilities. Research has been done with regard to female sex workers. And for instance, it was found in Gauteng that 88% of female sex workers abuse substances, mainly alcohol, but they also use other substances. And then, as indicated, we also have the Ekulureni Declaration, which is the declaration from a conference that was held in 2019 in Ekulureni, and the resolutions that we have to ensure, these of course are included in the National Drug Master Plan as well, that we have to report against these resolutions. One is the legal framework to restrict access to and availability of alcohol, minimize manufacturing, supply, and trafficking in illicit substances, strengthen collaboration, and have an integrated and balanced approach in these strategies, and then increase investment in health prevention and intervention services and all the other interventions that you have to manage this, manage substance abuse and SUDs, and then mainstream moral regeneration and restoration in all the substance abuse program. Improve data collection and surveillance system. Again, the issue around research comes through, and mobilize and involve communities, including NGOs, CBOs, FBOs, faith-based organizations, labor, business, research institutions, etc., to strengthen families. And then strengthen regional, continental, and international cooperation, which really I don't think we are doing that well. and then ensure equal access to and distribution of resources for civil society organizations in previously disadvantaged communities. Program facilitate, I don't know what to do with this thing, with the screen, because it keeps tampering with my presentation. Okay, the findings and analysis and findings around the annual report. Firstly, in relation to the CDA and its structures, the reports received from the 9 provincial substance abuse forum, and all of them submitted this report, and it says then that they are fully functional, but in different degrees. And it's something that we need to still look at as a CDA to say, how do we strengthen provincial substance abuse forums? How do we support them? Especially in view of the fact that we know that they don't have resources that they should have to be able to operate efficiently. And out of the 278 municipalities that you have here, we are not even sure how many local drug action committees were established. The reports do not indicate the number of local drug action committees that were established. So we need to strengthen that area as well. Some departments still do not have representation in the CDA, and this is contravention of the legislation. And these departments also, of course, would not submit reports. And it's something that needs urgent attention. Other departments fail to submit reports despite efforts of the current CDA to remind them to do so. We had and to sensitize them about the need to submit these reports. We had roadshows to national departments and to provincial departments to encourage them to submit reports. And the provinces responded very positively, but some departments nationally still did not respond. The CDA itself was largely not functional in the year under review, which is 2021, the year 2020-21, and participation was incidental to the invitation by departments. So for instance, the one department would invite the chairperson of the CDA to go and make a presentation somewhere, and the chairperson would then go and make the presentation. But there were no meetings of the CDA, and this was a problem for almost a whole year. And you'd remember that the CDA was established, I don't know, but their period was extended by about 2 years, but things fell through the cracks after that. And only the governance committee of the CDA was functional, focusing mainly on the review of the National Drug Master Plan. Again, there was poor submission of sector drug master plans and quarterly reports, as expected in the National Drug Master Plans as well as in the Act. And there was no structured collaboration with regional and international agencies. That collaboration that was there and that was reported by different departments in their reports was actually with those particular departments, but there was no concerted effort by the CDA to ensure that we tap on the resources that we have at a regional and international level. Departments, for instance, social development implemented the Colombo plan and got people trained in substance abuse treatment. There was interaction with the United Nations Office on Drugs and Crime, the UNODC, and other international structures. But I think it's important that we realize that these structures have got a role to play. We are signatories in some of the resolutions of these international agency. We have to report. The reports do go out, but really they're not consolidated properly to reflect the situation in the country. And I think this is something that we need to strengthen. And then again, there was no concerted and purposeful effort to meet the goals of the National Drug Master Plan. Departments just reported on what they are doing, and not necessarily to say we are meeting these goals of the national. There was consciousness in attempting to meet the goals of the National Drug Master Plan. And of course, some of the goals were met, but it was not through that effort. It was just in the form of saying, okay, we have submitted a report and we have done this thing as a department, and not in collaboration with other departments or in an integrated way. And some departments would collaborate within clusters. For instance, we saw some collaboration with the security cluster and subs working with other agencies. But for the rest, across clusters, there was limited collaboration. If you have a child who abuses drugs and the child gets arrested, there is legislation that provides for those things. But how do we then render prevention efforts as a collective? And do we have enough information to be able to address those challenges that children have in a more holistic way, rather than focusing on them being sent to places of safety or whatever other strategies are employed to deal with those children? And there's still a punitive approach to people with substance abuse disorders, instead of recognizing that it is not a brain, it is a brain disease, and we need to have appropriate treatment regimes for it. So for instance, the kids would get, again, as I indicated earlier, with SUDs, and you have children who are as young as 15 and 10 years old, and in some cases less than 10, that are abusing substances in different provinces, as was shown by our situational analysis. And I would urge members to really read the annual report to get a sense of what is happening in the country. And then the reports are not compliant with the National Drug Master Plan framework. And the CDA has to use its own discretion in terms of how they interpret the reports, and also make value judgments. So some departments, instead of submitting proper reports, submitted PowerPoint presentations, which were really not helpful and not assisting us, because we had then to sit down and try and understand where these things fit in, whereas the departments could have done these things on their own. Now, just to give you a sense of how we analyze the reports, I didn't mention the name of the department. This is just the framework that we're using. We had key activities, and then we had deliverables, which are prescribed in the reporting framework of the National Drug Master Plan. And then we have activity contributing to a specific outcome, as indicated, the 5 outcomes of the medium-term strategic framework, and then the achievements of the departments. And then we use keys for outlining the achievement, the extent to which the activities of that particular department is aligned to specific outcomes and to the different conference resolutions. So this is how we presented the reports, and all the reports of departments and the provinces were analyzed in this fashion. The gap, though, was still with the inclusion by the Provincial Action Substance Abuse Forum and some departments that work with NGOs to say what was the role of NGOs, how effective was our intervention and our collaboration with these NGOs. And then again, with regard to reports, the reports again submitted by national departments. And I would like to echo the chairperson who congratulated the national departments that submitted reports, and really serious efforts were made in most cases to submit reports that were workable, that we could use and that really attempted to give us an indication of how well they have done, and where there was honesty as well, in terms of areas where they did not do so well. But the report submitted showed that there is a serious effort to combat substance abuse and to mitigate its impact in the country. Departments are doing a lot. It just needs to be integrated so that we are focused in our approach. Maybe I could just give an example. If a department, for instance, runs, because all of us, all departments reported very seriously on goal 1. Apologies, on goal 1. But then the issue then is all of us are working in silos. We are not really making an meaningful impact where there's a greatest need. So a department, for instance, social development, would run a program in a particular area. Gauteng would run a program in Gauteng in a different area. SAPS would run a program in Gauteng in a different area. And this is not workable. And we need to start thinking clearly and looking at the hotspots with regard to substance abuse and say, how do we integrate our efforts and maximize our input in those areas so that we can see value for money and also real change in the way substances are managed. And then provincial reports also showed the great measures put in place to manage the scourge and to reach out to affected communities. The next challenge is to measure the impact of the interventions. Concerning is that only 2 provinces and 1 national department reported on goal 6. Which is a critical aspect of understanding the problem, measuring the impact of interventions and monitoring evaluation. There is no research, there's no evidence-based, there's no indication that what we are doing is evidence-based. We are not measuring the results and impact of the services that we are rendering. And then the national department, no national department reported on goal 7, and there were no goal 7, and there were no actionable plans from provinces around goal 7. And these are areas that need attention. So as we look at the National Drug Master Plan, our sector drug master plans, our performance, we need to start looking at implementing all these goals, especially where they are applicable. Now, what I have done here was just because one of the areas that I was supposed to attend to in this presentation is the issue of how we need to report. This is on page 84 of the National Drug Master Plan. And colleagues, I'm sure we can actually go and have a look at that and report in using that framework, because it covers all the areas that we have indicated previously. This is just but one example. Say there's a goal and then the objective. What is the objective that you want to address under that goal? What are the key deliverables that are expected? What are the key actions? Who is responsible? And then KPIs, and then the timeframes. You need to give an indication, not just in terms of the financial year, but also in terms of how you, if it's a quarterly report, for instance, for the next for 3 months, how do you plan to roll it out? What are the achievements on a quarterly basis that you want to attain? And then, of course, it will also address the issues around the resolutions of the conference, as previously indicated. I will not go into detail, but this is roughly the framework that must be used for reporting. Facilitator and colleagues, this is the first time that reports have been analyzed in this manner by the CDA. Normally, we would get reports, or the CDA would get reports, and then you just package them, put them in the annual as addenda to the annual report. This time, we really made an effort to make sure that we do some kind of analysis and to identify the gaps that have already indicated. We show gratitude to the departments and provinces and stakeholders that have enabled the CDA to table a report to Parliament, because without your input, without all the reports that we have received and those that we still expect to receive in future, we cannot submit a report to Parliament. The hard work that you have shown is commendable. We also appreciate the operational environment was challenging with COVID-19 and there's restrictions, but it's amazing because we prevailed. More work lies ahead, and the CDA is awake to the realities and challenges that face us as we roll out our programs. I'd just like to, again, thank all of you for listening to me. And I would urge you, I am sure Nomco will give us an indication, or our communications unit or committee will give us an indication of how this report can be accessed. Please take time to go through it, departments, provinces, and other stakeholders, so that you can assist us to identify areas where we can improve, areas where we can ensure that when next time we report, we are able to give real information on how we have really changed the situation around drugs and substance abuse in this country, and also achieved the vision of the National Drug Master Plan and the Act and the CDA's vision of a society, or of a South Africa free of charge, free of drugs. I thank you. Over to you, facilitator.
Thank you very much, Ma'am Kela, for that inclusive presentation. I must commend you and your committee for the hard work that went into compiling the annual report. I know it wasn't easy, just being newly appointed, and I know it was quite a struggle, but well done on compiling that report. Also, thank you very much for taking us through the expectations of those 21 departments. I know the National Drug Master Plan clearly speaks to the importance of all role players and stakeholders, but sometimes, you know, those departments are asking, what are we supposed to do? And you've mentioned quite a few times that the National Drug Master Plan outlines, and now it even gives a framework on how reporting should be done. So I trust going forward, and because of engagements like the one that we're having today, we're going to get those reports, and people will know, and departments will know what is expected of them. Just over to our technical team. I know that there's a video that they're supposed to be playing, the scorecard video. Can we now move over to the scorecard video? Thank you very much for that video to our technical team. I've also been seeing there's a few questions and inputs coming through saying that we did report on certain goals, also saying that our department, we delivered on all the goals. Please note that we didn't specifically highlight, where the lack was. So there are departments that gave sterling reports through to the CDA, whilst there were those departments that didn't actually report on anything. So thank you so much to those departments and those entities that did report and reported on all the goals highlighted in the National Drug Master Plan. For those of you who've also just joined us, where we are in terms of our program, we've just had our governance chairperson, Ms. Keller, do her presentation on the National Drug Master Plan reporting template as well. She also took us through the annual report. We've had the scorecard video. Next, we will be facilitating a discussion on implementing the National Drug Master Plan, and we'll be talking about the challenges, the outcomes, and the recommendations with departments as well as the provincial substance abuse forums. I'm not sure, I'm hoping that I'm still audible.
You are audible.
Yes, you are. Yes, you are, facilitator. Please proceed.
All right. Now I just like to ask for input from the members that are and our attendees that is on the session. Let us just discuss the challenges and the outcomes based on everything that you've heard. And at this point, I'm also going to be inviting in our chairperson as well as the group governance chairperson, Ms. Keller, just to assist and facilitate with the discussion that we will be having right now.
Hello.
Good morning, facilitator, once more. I think that what would assist is for you as the facilitator to maybe have a look at the chat box, because as you're indicating, some of the representatives from the provinces are beginning to have a discussion around the annual report, so that we can then take care of those chat groups. And then perhaps we can allow other members who have joined us, other stakeholders, to then also raise issues. I don't know if we have a hands up. I think there is a hands up icon there that they can use to basically raise issues. So that's how I think we should then proceed. Over to you, facilitator.
Okay, I'm just battling here to open up the different screens, but I'm here. Let me just go through some of the input that we received from the attendees. Chantal indicated we did exactly what you trained us on, how to report. Please, may I have the chair's email address, because I would like to send her my annual report, because this has to be addressed. Please, thank you. It took me over a month to complete the report whilst I was recovering from COVID. Thanks to the LDACs and our DSD funded organizations, we most certainly achieved under goal 1, and for nothing to be included is really a mystery. The annual report from Western Province all includes the reporting directly to me. No one sends it directly to National. Sorry, we have done the hard work, and for our work not to be included is just unacceptable. Can I go over to the chairperson for you to maybe just respond to that? Chairperson?
Yes, let's allow the chairperson of the governance committee, who's responsible for the annual report, to respond to that particular question. But I think you had indicated, facilitator, earlier, that in analyzing the reports, our team decided to analyze the reports and basically, highlight all the achievements from the departments, highlight the challenges as well. But I think the chairperson of the governance committee who prepared the report can further respond to that particular question. But I don't think departments and provinces should be worried about that, because we have analyzed all the reports that we received. But if it happens that there are reports that we received and were not taken care of, we shall address that situation. Over to you, Chairperson of the Governance Committee.
Thank you, Chairperson. Yeah, I note the concern from Chantel, and it is a valid issue that she's raising. But I'm also grateful that she indicated that she has sent an email to the Secretariat, and as people that were drafting the report, we didn't get that email. So if please also bear in mind that this is the first time that this analysis was done, and there might have been omissions. It's something that you can refine as we go along. And if really there are mishaps, please send us and give us an indication of where the mishaps were. But please just bear in mind that the exclusion of your input was not intentional. It was the rate at which we were going, perhaps, and perhaps you did not get all the information or understand all the information that was given to us. But please communicate with the Secretariat and communicate with us so that you can find a way of addressing the issue. Thank you very much. And this would apply to all the government departments and all the provincial substance abuse fora and anybody else. Please bear with us if there are gaps in what we have done. Yeah, thank you very much. But please alert us to those gaps. Thank you very much.
Thank you very much, Chairperson of the Governance Committee. Chantel, I see you're asking for the email addresses. We will share the contact details of the CDA members as well as that of the Chairperson, and we will circulate it after today's session to everyone who attended today. Thank you so much. I trust that that answers your question. I also see there's a statement here. Challenge is that much is being done and major challenge is under-reporting from stakeholders. The new template is problem to incorporate activities in black and white, but slowly, surely it will get done correctly. Yes, like Stella just also indicated earlier on, we are new at, and yes, we are trying our utmost best to streamline activities. We've also indicated earlier on that there is a great gap when it comes to reporting and just having a synergy across the board with all departments. We are surely working at a reporting platform that would include all stakeholders and a portal where we can sort of have an integrated approach when it comes to reporting so that we're all on the same page. I see that is it from the chat. Is there any more input from our members and our attendees? Chairperson and Ms. Keller, is there anything else that you'd like to add on or just like to highlight?
Well, facilitate, I'm just seeing other comments here. But I think from my side, it would be to say, let's work on these things. The reporting framework is not easy and we are not used to reporting in this fashion. So it's something that we have to apply our minds to and help each other do properly going forward. And I think with time, we will grow and we will improve. All of us need to just apply our minds and make things work so that you are able to report in an efficient way and that you are able to really put measures in place that will enable, at the beginning of the year, already know what it is that you are going to do and how we are going to measure it and how we are going to report on it and all those kinds of things. I think that's very important and it's something that we'll have to give attention to jointly, and we are open to advice and assistance. And of course, if it doesn't work at all, we also need to hear what you are saying so that we can then look at how these things can be reviewed. If the majority of people think it's not working, then we need to really go back to the drawing board and see how we can change things. Thank you.
Thank you very much, Ma'am Keller. I'm also just going to read another message here from Sean Shelley. I think it's commendable that the CDA and the relevant structures are taking a more structured, scientific and timeous manner. I hope this continues even as gaps emerge. An area we really need to look at is the effectiveness of interventions and the return on investment for interventions. For example, there's little data that supports traditional inpatient rehab, which is ineffective and expensive when compared to community embedded services. An improved, robust monitoring and evaluation system would help. Also here, Nonsikikelo, sorry for the pronunciation, the implementation of the drug master plan becomes a challenge since specifically for the national drug, for the NYDA, our role is coordination. We facilitate for programs to be implemented by departments and civil society. However, the stakeholders are not able to implement youth
Facilitator,
respond to that?
you are not clear. May you kindly repeat the chat that you have just read because it was not clear from NYDA? Thank you.
Okay, from NYDA representative, she states the implementation of the drug master plan becomes a challenge since specifically for the National Youth Development Agency, our role is coordination. We facilitate for programs to be implemented by departments and civil society. However, the stakeholders are not able to implement youth-specific programs as it becomes a non-funded mandate for them. Have you got that, Chairperson?
Yes. I've also got.
I'm going to read another comment here by Sean Shelley. It is noted that this is a process and steps are being taken. The increased inclusion of services implemented by research done by civil society. In there, I've said that we need to come up as the fourth CDA board. It has been something that we've been talking about since the day we've been inaugurated, that we need to look at a system, a reporting system, a national reporting system, a portal that can obviously report all findings of all rehab institutions so that we are able to compile a database and have informed surveys and research. Our technical team, I see we have a hand by Shoki Shabalala.
Thank you, Chairperson. Good morning to yourself and the facilitator and participants. The issue raised here by the NYDA and other members on the chat group around unfunded mandates or lack of funding is a cause for concern. We can only use the budget as a tool to turn the tide against substance abuse, any form of substance abuse. And in the absence of that, it's not going to be easy to do that. I think it is important that we keep playing an advocacy role for a substance abuse responsive budget. And the best way we can do it is to ensure that at a planning phase, including us in government, that we address this clearly and sharply so within our own annual performance plans. We ensure that it is resourced within existing baseline. We may not have huge budgets, but there is some allocation. So based on the template you gave us earlier on and the key objectives or the outcomes, each and every department should be compelled to indicate what they are doing and how they are resourcing those activities. I'm not so sure, I can't talk much about civil society organizations, but the whole issue of funding definitely will come into play as and when we engage. But from government side, we can share some lessons how we have managed to infuse the National Strategic Plan on Gender-Based Violence into the annual performance plans of the departments, whilst we are still addressing the full costing of the NSP. It's gradually yielding the desired results. So some of those lessons can be learned. Some of the issues can be taken up even at MEC, MMC level. I'm glad our chairperson, with a previous experience before, she would remember how we used to push vigorously at MEC and MMC fora so that this issue of unfunded mandates get addressed there, because it's there in the prescripts. So the only way to do it is to deal with it at a planning phase. We'll begin to see the needle shifting. At this stage, we'll still come back at the next session again and still say they are not doing much because they feel it is an unfunded mandate. So we can put our heads together to share some lessons that we've learned so that we add value to this process. We ought to report, and it's not a matter of choice. I think we are obligated to report and to resource the activities. Thank you, Chairperson.
Thank you very much, Ms. Shabalala. I know we've journeyed with you for many years as well, fighting substance abuse. Thank you very much for that input. We take note of that. Let me just go back to our chat and see if there's any more. I see here there's a comment from a Julie McDonald. I feel it is essential that we see more collaboration between DSD and Department of Health in order to work effectively in the most vulnerable communities where substance use facilities are limited or non-existent, particularly in rural areas. Department of Health has a strong footprint in these communities with healthcare clinics. We need to be looking at how we can strategically roll out substance use services through existing community structures. And that is where I think your LDACs come into play, and why it is so important to empower and equip your LDAC so that this becomes their role in the communities, especially on community level. We also have Chantal Pepper here saying, I can most definitely share my success with LDACs. Mosselbaai LDAC, for example, has adopted a model regeneration strategy and substance use disorder plan 2 weeks ago by council, but they had to do a needs analysis first, then intervention, and now they have allocated budget to the implementation. So we are having great success with our LDACs in this province. Thank you so much from Chantal. That is what we need. The LDACs are the people, are the forums closest to the people. They are on the ground. So we need to get behind the LDACs and empower those committees to enable them to do what they need to do according to the National Drug Master Plan. Nadine Harker, greetings all. Thank you for the presentations. One of the previous speakers mentioned the need to work as a collective and not in silos. I agree the better synergy between research and practice needs to be forged. While inroads have been made in respect of treatment, further collaboration work is needed as far as it pertains to addressing and understanding prevention and harm reduction. I'd like to give an opportunity. Is there any one of our chairpersons that would like to respond or come in at this point? Okay. Vincent here says higher help.
Sorry, Madam Facilitator. I just wanted to say that we appreciate these inputs so much. And I think maybe in terms of moving forward, what we are going to do is to really have to go through these the inputs that have been made through with a fine-tooth comb, and really try and look at how we can improve on what we are doing, not only from a reporting perspective, but also from a service delivery, implementation, monitoring and evaluation perspectives. There are huge gaps that are currently being identified now. But and I also think that we need to learn from best practice on the ground. For instance, the LDEC in Mercel Bay, how they've managed to set it up, to have it funded, to have it fully functional, and incorporating as well some of the strategies that are provided for, and no one, for instance, moral regeneration, no one is actually talking about it to the extent that we should. So perhaps from those lessons, from those practices, we can draw very valuable lessons. And I think it's the role of the CDA to ensure that we draw from that and document them properly and make sure that we use them to guide and support the other local drug action committees. But I also wanted to comment on Shoki's input. I will say Shoki because we've worked with her in the past, but I think it's also critical that we look at how best we can get a responsive budget for substance abuse in all the departments and also for stakeholders that we are working with. And I would be very excited, and please excuse me if I'm being forward. I think we need a representative from the women's department as well to get invited to the CDA, because they would then inform us about what it is that they have done with GBV and how successful they have been. I know SANAC is also one of the other stakeholders that we can draw lessons from, and I think that we will definitely look at how we can engage all these stakeholders and make sure that they have a meaningful input in the CDA. And I'm sure all of us are encouraged now that we see that there is something serious that is happening in the CDA. The issue around research is really a very critical one. And I think a facilitator, we need our research committee. We do have a research committee that is going to be looking at this, and I'm sure they are listening, and they will be taking some of the processes forward. But in terms of going, I think we will give ourselves time and we, to look at the inputs that have been made and to really try and respond effectively to the inputs. Thank you very much. Thank you, facilitator.
Thank you very much, Ms. Keller. I have another question here or comment from Audrey Vermeulen, and I'm not sure if she's still with SANCA. I remember working with her. She says, please look at my previous comment as one could learn from CATCA model, as this model provides the evidence-based tools that the LDECs could use to empower and capacitate themselves to be more effective. Now, I'm going to ask for RG to please email us the CATCA model so that the board can also have a look at this next week at the plenary meeting, and that will really help us moving forward. Sean Shelley then also states, we should note that problematic drug use is a symptom of marginalization, economic marginalization, and systemic factors. As such, the best interventions are often not directly related to drugs in an obvious way. Healthy communities where there's a sense of belonging, hope in the future, and a variety of choices for youth will impact significantly. I cannot agree more to that. input and statement made by Sean, we often think that drug use just stems from the fact that, you know, someone just woke up and decided to use drugs. And this is why the National Drug Master Plan speaks to the 21 departments. I know there's a perception that it is only the responsibility of SAPS, it is only the responsibility of Department of DSD, Social Development, but everyone has a role to play. And this speaks to exactly what Sean says here. Healthy communities that have been marginalized. So one would ask, where does the Department of Housing, the Department of Transport, Department of Trade and Economic Development, all those departments have a role to play when it comes to fighting, dealing and addressing substance use in communities, especially also when it comes to reintegration of users. That is where trade and economic development comes to play, you know, in terms of employment, providing jobs. All the departments have an equal role to play when it comes to the eradication of substance use and abuse in our country. Are there any more comments? I don't see any more comments. We are now at 10:30. Is any more input from our attendees? And I'd also just like to reiterate, you know, our chairperson mentioned earlier on, and she said, you know what, the purpose behind today's stakeholder engagement is to get a feel of what is happening in the various departments, to also get input that would help the CDA in crafting the sector-based findings when they meet later on this month. So please don't feel that your input is null and void. We're recording everything so that, you know, at the start of our 5-year term, we know and we understand the feel and we understand the challenges that are out there that exist within the different departments. I see Audrey has responded and she says, yes, she's still at Sanker and she's going to be emailing us the CAPCA model.
Facilitator, there are hands that needs to be recognized. Thank you. Whilst there is a challenge with connectivity for our facilitator, kindly note, facilitator, that there are 2 hands to be recognized. There's a hand from Prof. Ramnik, and there's a hand from Guru, and there was a hand also from Advocate Andrea. Could you kindly recognize those hands?
My apologies, I'm having technical difficulties. I seem to be going in and out, and when I come back, I don't see any comments or there's just no hands from anyone. So could you just assist me with recognizing?
Thank you, facilitator. May I assist from this point? Let us recognize the hand of Prof. Ramnik, who will then be followed by, allow me to say Ntate Ome, because I'm not sure how to qualify some. And we have a hand from Marcus Masemula. And then we also have another hand from Nozuko Majola. May you kindly follow that sequence? Kindly go ahead, Prof.
Thank you, everyone. I'm Prof. Ramnik Aluwali. I'm from the representing the Department of Higher Education and probably over 200 institutions in higher learning. And my engagement is predominantly on behalf of all public universities, which are 26 universities, 50 TVET colleges, about 9 community education colleges, about 132 private higher education institutions, and of course our 21 CETAs and our skill development providers. We've got about a system of about 2.5 million youth in our system everywhere, and got a huge, as per our studies, and if you look at our data perspective, we've done enormous underground studies regarding the depth of drugs and alcohol and its direct correlation to our skills development program, our youth success, our graduate competencies and stuff. So on behalf of that, first of all, let me welcome this Drug Masters Plan report, and I really appreciate, and as on behalf of the department, we pledge to really be a very big role player, or would like to be a big role player, considering the depth of drugs and alcohol that affects our system. As you also know that we have many other pandemics like mental health and gender-based violence, which are predominantly high in the higher education system. As per our WHO and our own studies have clearly shown that 65% of our GBV is preceded by drugs and alcohol. We got very high rates of both substances, both alcohol as well as drugs, and we have deep research understandings of which drugs and which areas and what areas of high alcohol. So my area of questions or discussions with CDA will be on working with us on our policy development towards the sales of alcohol and drugs, including the tavern control or the tavern proximity to our campuses. If you go to our Karankuwe or Shashinguwe sites, you will see just around the gates of our entrance of our young students, we have taverns. And I think it's a deeper conversation that we want to have with CDA to assist us and work with us, working with municipalities in addressing these very sensitive issues. We have a huge prevention awareness program. We've got extramural curriculums running on drugs and alcohol. I think CDA can play a very big role with us to improvise our curriculum. We reach about 1 million young people through this curriculum every year. We've got peer-to-peer programs that needs more guidance and needs more, far more better research support intervention so that we can support the drug master plan in that area. I think nothing can go less than education when it comes to prevention. We are making a lot of inputs into risk screenings at early stages of drug addiction and substance abusers, and we think CDA can play a very significant role with us on strengthening our self-risk assessment toolkits, which obviously links to care. We'll be happy that we are partnering now Sanka and others for referral system, because that's where our block systems is, because we can do risk screening, but if we don't have a linkage to care mechanism, we do struggle. So I just wanted to welcome this report on behalf of the department, on behalf of all our institutions. We have a very dire need. We are a very vulnerable group with a lot of peer-to-peer influence, very early stages of adolescence or late adolescence and early young youth, where addictions and alcohol abuse and drug systems quite come deeper into our system. And it's actually, we have clear now understanding, and that's why it's part of our key performance area now, and mainstreaming of drugs and alcohol in our institutions of higher learning due to its direct correlation to skills development, gender-based violence and mental health and other challenges that are affecting our graduate competency. So thank you, Chair, for allowing me, and back to you.
Thank you very much, Prof. May I check with facilitator if she's connected? However, if she is not, may we continue with Ndatimak?
Yes, I'm back. Thank you so much, Chair.
Thank you. Back to you, facilitator.
Yes, I'm back. Thank you. Thank you so much, Professor Ramnik. We appreciate that input. Can we move over to our next hand that was recognized? I think that was Marcus Masimola.
Good morning. Thank you so much. This is Marcus Masimola from Mpumalanga Province, the chairperson of Mpumalanga Provincial Substance Abuse Forum. We want to welcome the report presented by the chairperson of the governance committee. In the same note, we also want to take the opportunity and congratulate and welcome the new appointed members of the CDA. On behalf of Mpumalanga Province, we wish them all the best, and we also hope that we will have a fruitful relationship moving forward. Then my last comments on the matter is that I've raised it on the chat, but I think the facilitator missed it. I want to submit that I think it's important that we, as a CDA, maybe you coordinate a session where we'll be capacitating all stakeholders, government and non-government stakeholders, with regards to their roles and responsibilities in implementing the new National Drug Master Plan. At some point, you might assume that people know their responsibilities, and that will be a challenge for us. But now we want to submit to say, let's look at the matter of conducting that particular session, maybe in the near future in terms of the plans of the CDA, so that everyone has been taken on board in terms of their roles and responsibilities. And of course, will be guided by the very same National Drug Master Plan and the Act 70 of 2008. Then it will assist everyone not to be seen wanting in terms of what they're supposed to do and their responsibilities. That will be my comment. Thank you so much.
Thank you very much, Mr. Masemola, for that useful input. Can we move over to our next hand? And I'm going to ask those who have had an opportunity to speak to please Nozuko, are you there?
Yes, yes, Chair. Thank you very much, Chair. Let me start by apologizing for our CEO, Dr. Kulu. She couldn't make it this morning, and she has sent me to represent her in this important engagement. Thank you, Chair, for the report that has been tabled in front of us. And coming from the HIV and AIDS space, social and structural determinants are a big thing, and we have not done much in terms of addressing some of the issues. Yes, at a smaller scale, SANEC and the implementing partners are doing some work in the communities. However, there isn't much that has been done to ensure that all those 7 goals, in fact,
I think, when we use...
I'm so sorry, ma'am. Can I just ask all attendees to mute their mics?
Yes. So when I'm looking at the 7 goals of the Drug Master Plan, actually they are almost similar to the NSP goals. And it is important from our end to ensure that even our stakeholders, the heads of secretariats, the AIDS councils in provinces and districts are also, they get involved in this important work, so that because as a country we are lagging behind in terms of addressing these social and structural drivers. We are working closely with Department of Women in dealing with gender-based violence, but when it comes to issues of drug abuse and substance abuse, we haven't done much, and it's a by the way thing, if I can put it like that. And biomedically, when we are looking at HIV and AIDS, we are doing very well, but we know that until we address the social and structural drivers in the community, we are not even going to achieve an AIDS-free generation. Just like we are aspiring for a drug-free South Africa, a AIDS-free generation is aligned to that. And then the other thing was the issue of coordination. Yes, Chair, you've mentioned that we've done a lot of work in terms of coordination, and we've got our AIDS councils in place. However, they need to know other structures that are in the community and have an opportunity. When we've got PCA meetings, they can come and also present in our PCA meetings, and also vice versa. And then another thing that I would like to raise is the issue of prevention. prevention for HIV and AIDS. Prevention is the biggest goal, is the biggest priority when we talk about the NSP. And if we don't use combination prevention, indeed, we are not going to succeed. So, Chair, in those words, I'm just saying thank you very much for giving us this opportunity. And I hope that SANEC will be the central stakeholder as we are trying to address these societal challenges. Thank you, Chair.
Facilitator, may you kindly unmute? The other hand that was up was from Mr. Guru. I'm not sure if at all they still have their hand up because at some point it went down.
Thank you so much, Ma'am Keller. I don't see any other hands. Anyone else that would like to give input?
Sorry, Madam Facilitator, it's Advocate Johnson. I did have my hand up and then I think my little blue hand disappeared. If I may, through you. I just wanted to make a comment. I did type it into the chat, but what has become very apparent from the interactions of this morning, more so with regards to the chats on this platform, is that the CDA will have a lot more work to do in terms of evaluating other role players that we may not of necessity, given the short time from the date of our appointment to these feedbacks, and some of us not having been involved in the CDA previously. There are very, very valuable stakeholders on this platform with very valuable input to make. And so it will become important then, Madam Facilitator, that in terms of us going forward, in terms of our future planning, we've got to take note of all of the feedback that we've received, but also then categorize them into what becomes more meaningful interactions. I think a lot of the chats actually give more room for different kinds of interactions on different platforms in different combinations, and not everything would have to be only CDA board members, for example, but would be led by the CDA. So the chats are really very valuable. And I think they give us a different insight as well, Madam Facilitator, that in terms of a broad spectrum, there really is a whole lot of work out there with a whole lot of bodies and great minds that are prepared to hold hands with the CDA. And so I guess going forward, as well with governance, we need to work out how we're going to deal with all of this so that we give the country and our people in terms of the various programs, even if it is just through the prosecutions and investigations, border management control, not just the NGO and treatment action campaigns and awareness programs, that we give the country a holistic list of actions from the CDA so that I think we change the ball game from what was previously given and or expected. Thank you very much, Madam Facilitator.
Thank you very much, Advocate Johnson. There was one more hand, if I can recall. I think it was from Mr. Guru.
Yes, Madam Chair. If you can hear me, may I continue?
Yes, you may, sir.
Thank you, Madam Chair. The comment I want to make is that any organization grows and develops on an analysis of their errors, shortcomings, and mistakes of the past. And I think we, as CDA, have met a lot of shortcomings. And we need to ensure how we are going to ensure that this does not happen next year and the years to come. Earlier on, the speaker mentioned that we should capacitate all stakeholders to be able to report appropriately and comprehensively in response to our requests. I suggest that we have some type of orientation or training for the reporters each year, because we've got to make allowance that there are new people being appointed on the LDACs or the provincial committees and so on, who may not who may require skills on how to report. So one of the things we need to look at annually is a sort of orientation or training for especially the new people. And as far as shortcomings are concerned, maybe the audience today are some of them who may not have had representations. Also, it may be that there were shortcomings, they did not submit reports. What we need to do is at some stage have a meeting to analyze where there are these shortcomings, why are there shortcomings, who is responsible for the shortcomings. And if we can answer the question why, we'll be able next year not to have any shortcomings at all and to have 100% reports. And two other points is we need to take cognizance of what Chantel Pepper is saying from the Western Cape, which seems to be doing much work, but for some reason, perhaps some of the information has not been received by the CDA. And the last point I want to make is that we need to establish a central data bank or repository or a library in which all information is stored to be used nationally. This data bank can update as time goes on with things like research that the chair mentioned, can also update with networking with national and international bodies as well, so that we learn as we go along. And I heard the Prof's comment earlier where he's prepared to work with us. And I think there are many other people who are prepared to work with us. I think together we can make a difference. Thank you, Chair. That's my contribution.
Thank you so much, Mr. Guru. I appreciate when you said we grow from our challenges, and that is exactly why we are having today's discussion. I think what comes out of all of the speakers, that it's clear that there's a dire need for capacity building, a coordinated reporting structure, and definitely that data bank portal. I think that many of the efforts are going unseen and unheard of, and which is really needed towards that goal of a drug-free South Africa. So all your input today has been noted, and thank you very much for that. If I can go back to our chairpersons, Ms. Keller, or the chairperson of the Central Drug Committee, any input from your side? Before we move over to our breather moment, our 15-minute break.
Okay, thank you, Madam Facilitator. I'm actually excited and very encouraged by the interaction that we've had this morning. And in fact, you'd remember that we said the reason that we are having this interaction is to just get a sense of where our stakeholders want to see the CDA as we move towards the strategic planning session that we'll be having next week. And I think these inputs are very, very valuable. And also just to say that as a new CDA, we've got our work cut out for us, because we're getting such a lot of information.
Definitely.
Okay, yeah. And Chair, also Facilitator, the other thing is that many of the comments that you are getting from, for instance, departments that can make a meaningful impact on the work of the CDA, those departments are actually represented, should be represented in the CDA. And of course, some of them are not at the stage. So we would want to pursue perhaps that engagement, because if you can get it right, the formal way where we communicate through the department and the structures of the department to get to the people that are supposed to assist us and to participate in the CDA, then perhaps this is a bottom-up approach that could assist us. For instance, with the higher education department, or Department of Higher Education, we could use your input, because really you are at the coal face of programs to our young people in this country. And this is where some of the challenges are. So in essence, what I would just want to say is that we will consider all the inputs and we will take them into account as we plan our way forward. But I think more importantly, we're going to get the stakeholders that are supposed to be involved in the CDA to participate, to come in and work with us. But also just to bear in mind that some of the stakeholders, remember the act was promulgated in 2008. It came into effect in 2008, and there've been a lot of development since then. So some of the issues that might not have been a challenge at that time, for instance, or that might not have been given that much attention at the time, like gender-based violence, and also what we are dealing with now in the current environment with COVID-19 and so on. Those things are not catered for in the legislation, but the National Drug Master Plan is going to be our driver and our Bible in this case to ensure that those departments that were not mentioned in the Act as having to be represented in the Central Drug Authority. Now we need to start engaging with those departments and getting them involved. But Madam Facilitator, I am really very, very excited, and I support all the sentiments expressed by the members and by Prof. Guru, who's also a member of the CDA, and I align myself with his sentiments as well. Thank you very much.
Thank you very much, Chairperson of the Governance Committee, Ms. Kela. We are now due for our 15-minute breather moment. Yes, it's been a I'll change to 11 at 11:05. Thank you very much. Any questions or input that's been given, we will definitely get back to it when we come back.
Welcome back to all our attendees. Are we here?
Yes, ma'am.
Everyone is back. Thank you so much. Just a sad announcement from me as the facilitator. We've just been informed that our deputy chair, Nonsebo, her brother has just passed away. So she's with her family at the moment. We'd like to extend our heartfelt condolences to her and her family. And I'd like to ask that we just take 1 minute just to say a prayer for her. Thank you so much to our attendees. Again, a warm welcome from me, your facilitator today. It's definitely been such a challenge in these trying times where the new norm is webinars. One has to keep, abreast of what is happening on your screen while gathering your thoughts. But yes, we are forging through. Thank you so much for the engagement. It's been robust this morning, and we appreciate the input from all the attendees. Where we are, if you've just joined us, where we're at in terms of our program. This morning, we've had our governance chairperson, Ms. Kela, take us through the annual report, as well as reporting on the National Drug Master Plan 2019 to 2014. We've also had a discussion with our attendees and our stakeholders, and we've managed to gather some of their inputs and recommendations, as well as challenges and concerns. And we've noted all of your input. We are now going to move over to a stakeholder engagement panel slide that will be flighting, followed by the demand, harm, and supply reduction discussion by our Reps Maboe. She's also the chairperson for our Social and Ethics Committee. But firstly, let us move over to the team. Okay, I see we're experiencing some challenges with that slide. I'm going to, at this point in time, introduce our next panelist, led by CDA representative, like I stated earlier, on Mrs. Maboe, as she heads up the Social and Ethics Committee. Today, she will be discussing Goal 1 and 2, which speaks to demand, harm, and supply reduction. Welcome, Mrs. Maboe, and over to you.
Thank you very much, facilitator. We also would like to send our sincere condolences to the family of our deputy chairperson, as they have just experienced bereavement. I would like to also take this opportunity this morning to thank you as a facilitator for the day to appreciate our chairperson of CDA, board members, distinguished participants, those who are on this platform with us and other adjacent platforms. The panel is going to be focusing on two goals at this point, goal 1 and goal 2. And just to give a brief before I go to the panel members, I'd like us to just, on reflection, just taking from the background that we have received already through the presentation by our chairperson for governance committee, now specifically onto goal 1. Goal 1's focus is to reduce demand through prevention and treatment of substance use. And the measurable objectives that we'd like us to highlight is the reduction in drug use, the percentage of substance use disorders treatment, and harms minimized. In the specific areas that we would want to touch on today would be one, just to highlight a few, to prevent substance use initiation and delay of uptake, and critically look at early intervention to prevent progression to substance use disorder, to make sure that we also increase evidence-based prevention programs to target risk groups in multiple settings, for we know that drugs know no boundary. So we need to have a multi-pronged approach, also working in multiple settings. We also need to develop a social mobilization and community advocacy strategies for demand reduction, whilst at the same time, we would need to enhance multi-sectoral cooperation to reduce demand for drugs, as it has already been highlighted by some of the potential collaborations and commitments from different departments and stakeholders on how we need to work on this, whilst we would need to critically increase participation of persons or people with substance use disorder in treatment programs to ensure adequate capacity, quality, and availability of evidence-based treatment programs and facilities. And we are mindful of the fact that when we are talking facilities, whilst there might be a limited capacity, is one area of development that we are also focusing on, whilst we would need to develop and implement the minimum norms and standards on treatment, of course, of SUD. That's the first goal that we'll be focusing on. And the second goal would then be, in the main, looking at reducing the supply of drugs through proactive law enforcement, effective responses to drug-related crimes, countering money laundering, of course, and promoting judicial cooperation. And that is why it's so critical to have all the departments and the stakeholders not only being participants in the process of interventions and pre and into and post interventions, but actually making sure that we work together as a team to accomplish goal 1 and 2. And just further to speak to just one or two specifics before I give to the first panel member, we would look at increasing capacity building and awareness to prevent drug-related crimes, whilst enhancing operational coordination at all levels and mitigating the supply of drugs and liquor through enhanced operations, where, of course, investigations and prosecutions have to be heightened so that we are able to deal meaningfully with this scourge and this challenge. Whilst, of course, as we would review and harmonize laws and policies related to supply reduction, and lastly, identify trends and control new psychoactive substances. And just as a lead panelist, we have a number of presenters panelists who will just speak briefly in these related areas that I have just highlighted under Goal 1 and Goal 2. What I'm going to request within the 30 to 35 minutes that we have, I would like to, as I call upon the representative from the respective either department or organization, it's for the panelists to come on and introduce themselves and just give us a very brief presentation relating to Goal 1 or 2. And I will, without any further ado, go to the Department of Health panelists. If you could kindly come on and then be able to give us your input as a panelist. Department of Health. And whilst we are waiting for the connection for the member from the Department of Health, I'm going to request SAPS member to also, panel member to be ready, the same as SADC, SANAC, SAMCA, NSPGBV, DGMT, and we also have higher health. I take that it relates to Department of Health. May I then give over to the panel member for Department of Health? And whilst we might be waiting for the Department of Health member to come on, could I ask SAPS to go ahead? We will go back to the panelists for Department of Health when they're available. SAPS, panelist member for Goal 1 and 2. Through you, facilitator, there might be a challenge that the technical team might have to assist with, because I'm not seeing any panelists being able to come on the screen. And whilst I've made that request, someone, the panelists from SADC.
Technical team to actually unmute panelists. If they are there, can they just give us an indication by sending us a message on the chat?
Thank you very much, facilitator, for that queuing.
All right, we already see that there's one panelist there. The technical team, as well as Ms. Shoki Shabalala from the Women's Ministry, if the technical team can unmute our speakers.
I'm going to request that at this point, I just slightly rearrange and go with the panelists who are available so that we would use the time effectively. I'm seeing May Shoki Chabalala. May I request that you kindly go ahead, because I see that you are already on the screen. You could assist by going ahead, and then we will rearrange as we progress.
Okay.
Thank you very much.
I'm not so sure. Good morning again, Chairperson. I'm trying to open up my camera, but it looks like it doesn't give me the rights to do so. But nonetheless, I'll proceed. I did not prepare a presentation as such, but I can talk to the issues in line with what would have been a presentation on my part. There's just one slide that I thought I would project so that you get a sense as to where we're fitting in and how we're fitting in as a Department of Women, Youth and Persons with Disabilities. This relates to the National Strategic Plan, to end gender-based violence and femicide. And the plan actually comprises 6 pillars. The first pillar is on accountability, where all of us put mechanisms in place in terms of policies, legislation, institutional mechanisms to coordinate the national strategic plan, but also reporting mechanisms that ought to be put in place. The second pillar talks to prevention mechanisms that we're supposed to also develop in preventing violence against women and children or any form of gender-based violence, including femicide. The third pillar talks to improving access to the criminal justice system, and it is led by the Department of Justice and Correctional Services. Then the fourth one relates to how to improve our response in terms of care and the kind of help that we ought to provide to victims of gender-based violence and families affected by femicide. Then the last two, and that one is led by social development, which is a critical stakeholder here as the lead department. Then we come to the fifth pillar that talks about economic power, that goes beyond just economic empowerment programs for victims of gender-based violence. Then the last pillar talks to issues that relate to information management, monitoring and evaluation and research. Now, in this instance, I would like to focus our attention on pillar number 2 and probably pillar number 1, particularly in relation to prevention. The department is developing a prevention strategy on gender-based violence and femicide. But again, the prevention strategy takes a multi-sectoral kind of a response or intervention mechanisms in that it involves government, it involves development partners, it also involves civil society organizations. So all the key departments within the criminal justice system have a role to play, including, and we are the lead department, including the development partners. And I'd like to emphasize on the role of the development partners and why we have all the UN agencies. We have UNICEF because they will focus on the issues that affects children. We have UNFPA that comes on board addressing issues of sexual and reproductive health rights. We are aware as we speak about the incidence or the staggering increase of teenage pregnancy in the country. Having said that, we would like to link the whole issue of teenage pregnancy and gender-based violence to COVID-19 pandemic. The president declared GBV to be a dual pandemic. So whatever we do, we address it looking at the impact or its twin relationship with COVID-19. So our work does not exclude applying a lens that has a COVID-19 lens, even though we are wearing a gender lens in the whole thing. So it's UNICEF, it's UNODC, so that they deal with the issues that relates to substance abuse. We firmly believe that any act of, most of the GBV related acts are linked to any form of substance abuse. So there's clearly a causal link between GBVF and substance abuse. Now in our approach, whatever we do, we make it a point that the prevention strategy speaks to all these key departments and the key development partners that are supposed to come on board, including UN Women. They are all under the banner of the UN agencies. But what I want to suggest and put forth to the CDA and in partnership with the Department of Social Development is that until we bring forth the Liquor Amendment Bill to Cabinet, led by the Department of Trade and Industry and Cooperation, I don't think we are going to deal with this matter successfully. We are playing an advocacy role. We are pushing hard to make sure that at the National Corona Command Center, this issue is addressed and that it finds its strategic path to cabinet. But we would like social development and the structure to liaise with the Minister of Social Development and raise this matter sharply so that my minister who sits at cabinet, who sits at NCCC, which is the command center for COVID-19, both of them can pursue this issue strategically to check how far is DTIC with the liquor amendment bill, because until it is brought to cabinet's attention and it elevates the issue of allowing for mechanisms to set up a fund, which fund will be used to pay for some of the civil society organizations that are doing this work, whether it's research or it's early intervention or it's prevention. We are going to rely on them to decide what they want to bring to the party, how they want to bring it. And yet, if there is a fund established, informed by this amendment bill, we can see how best these resources can be redirected strategically. We need to make sure that we go back to the Department of Social Development and also retrieve one of our old cabinet memos. We once had a cabinet memo that had indicated some limitations, that had put some limitations whether government should work with these traders or not in the sector. So if my recollection serves me well, we once had a cabinet memo that said we are forbidden from doing so. However, before I make more commitments in this regard, I've agreed to visit that part of the cabinet memo to check what it says. And if indeed it forbids us, to take it back again and hear what cabinet is saying, what direction they're giving us, so that we find a better way of working strategically. From my side, Chair, that's it at a very high level, but our emphasis is on prevention. We are working on a prevention strategy. All key government departments, including the criminal justice system, is on board, and all the UN agencies, including civil society, will be consulted at the particular point to make sure that issues of substance abuse are infused in the prevention strategy as well. I would like to pause at that level, and I submit, Chairperson.
Thank you very much, Ms. Chabalala, for the valuable inputs. We're going to move with great speed. I'm going to request that the next panelists take also 3 to 4 minutes, because we have a number of panelists. May we move to SAPS? SAPS panelist member, will you kindly take the platform now? Whilst I'm not seeing movement in that direction, or maybe while the technical team is connecting, the SAPS member, may I ask DGMT panelists to be ready? You'll be next if SAPS representative is not available. I'm just going by confirmations also that I've received. DGMT.
Thank you.
We'll come back to SAPS. Thank you. Kindly go ahead.
Sure. Thank you very much, Chair, and the CDA for the invitation. Truly, as DGMT, we see ourselves as a partner and a stakeholder in the work to support some of the social outcomes that the CDA is concerned and focused on, particularly on the implementation of the National Drug Master Plan and programs around substance abuse. Chair, specifically, we are interested in supporting the CDA and the DSD in the development of a multifaceted strategy, particularly around reducing alcohol harms. Our point of entry, Chair, will be around the issue of heavy drinking and binge drinking. I do want to draw a distinction here that there is, of course, occasional drinking of alcohol, and that is one thing, but I really want us to put the specific spotlight on binge drinking. Drinking that affects all of us, drinking that leads to drunk driving, the abuse of women and children, medical consequences and trauma cases and so forth. I'm sure we get the picture around that. To frame this issue, Chair, it is important that we highlight the following, that one, South Africa has a long-standing problem of heavy and episodic drinking. It's rooted in our apartheid past and continues to be prevalent generation after generation. It fuels a range of social harms, and I've mentioned some of them, including GBV, which has been articulated by the previous speaker. One of the enablers of heavy drinking is a weak regulatory environment that enables easy access of alcohol, including by minors, and the promotion of heavy drinking. Some basic economic modeling does suggest that there are both tangible and intangible economic costs linked to this one problem. The cost of healthcare, root causes of most trauma cases in hospitals over the weekend is heavy drinking, social welfare costs, crime prevention costs, road accident costs, and so forth. In contrast, these costs for the state far outweigh the economic benefits of a lightly regulated liquor industry, even if you take the tax revenue and the employment benefits derived from the industry. There are a number of national priorities that are unattainable without us curbing heavy drinking. For example, the major reductions in terms of mortality. Alcohol is responsible for more deaths compared to COVID-19, for example, more specifically among Black people. And as we are trying to address the issues of GBV, we cannot dismiss the fact that in almost most of the cases around GBV, 40% of them, of the perpetrators, for example, of rape, had been drinking or can provide reasons in terms of the fact that they were drinking when they committed those crimes. How we can tackle this? There's excellent evidence of what works in terms of reducing alcohol harms. The World Health Organization begins by highlighting 5 best buys or drivers to reduce binge drinking. They suggest that we need to address the availability of alcohol, advertising of alcohol, pricing of alcohol, the size of containers. These approaches are not meant to harm the industry, but rather to regulate it quite fairly. Chair, individual behavior alone is not what is driving the crisis. We need to take a serious stand around regulating the industry. The best opportunity to ensure that these measures are passed into law, that our generation is not further ignoring this particular issue, and that we create an environment and society that is conducive and progressive. The Liquor Amendment Bill, which has still not been passed, must be passed quite soon. Let's work together to try and achieve this particular objective, colleagues. Onesisa from DGMT, I'm not sure if you've got any comments from your side.
Thank you very much, panelists. I'm looking at time. We are really challenged with the limited time that we have. So may I kindly move to the next panel member? We have Sadak, and if you could kindly also try to be very cryptic in the inputs. Inputs are highly appreciated by the panelists. Kindly go ahead, Sadak.
Hi, good morning. It's Cassie Chambers from the South African Depression and Anxiety Group. Thank you so much for the opportunity. I think just for issue of time and just to briefly share some of our insights that also link to Goal 1 and Goal 2. I think through running the 24-hour National Department of Social Development Substance Abuse Helpline, we have during the last 18 months seen a huge increase in the number of calls that we're receiving. The majority of our calls are coming to us from the ages of 13 to 35. So we're seeing a direct impact on our youth. And I think having to really focus a lot of the interventions and programs on youth is really important. So really targeting that. I can also agree with our previous panelists is that we're seeing trends that alcohol is the most commonly used substance abuse problem. And then that becomes a huge issue, even during COVID. Some of the side effects of that, including, as mentioned, GBV and mental health issues. And I think one of the concerns that we have with really just focusing on our current COVID world, where a lot of people are afraid to access treatment in their communities, don't know where to go or how to access it. I'd like to also just echo what Sean Shirley had mentioned earlier in the chat box, is that we don't have enough community resources or community intervention programs and support programs. So for those that are needing long-term sustainable support, we don't have enough of that in communities. So I think as we're working through this and through the different achievements and through goals 1 and 2, we've also really benefited from having a very close relationship with the Department of Social Development's social workers and coordinators in Gauteng specifically, who have been really helpful in coordinating and getting patients hospitalized or in treatment programs quickly. And that's been very, very successful. And we hope to do that with other provinces as well. So that's all from me. And I look forward to networking more and engaging more. And I think through these kinds of platforms, never mind just the report, but these different organizations that are doing such amazing work, we don't always get the opportunity to network and to find out and to plug into what other people are doing. So I'm really looking forward to doing more of that, even during the session. So thank you.
Thank you very much, Casey. Facilitator, I'll need to take a cue from you because we are left with less than 10 minutes and I still have a number of panelists. I'll take the next panelist in the meantime from SANAC, and then we will see how we manage the remaining time. It might have to now reduce to a 1 minute to 2 minutes input from the panelists. Kindly go ahead.
Thank you, Chair. My name is Nosugo Majola from SANAC, and I'm just going to talk to the 8 goals of the NSP, but specifically focusing on the goals that are aligned to goal 1 and 2 of the Drug Master Plan. So most of our goals are aligned, and with goal 1, we are calling for accelerated prevention of HIV, and it's at the apex of the NSP. However, goal 3, that's where we start talking about key and vulnerable populations, which are also consumers of drugs and alcohol because of the level of vulnerability that they are experiencing. And then importantly will be goal 4, where we are talking about the social, economic, and cultural factors that are fueling HIV. And substance use is one of the key determinant or factor that is fueling the epidemic. So you cannot begin to respond to HIV without addressing those issues. So, and even when the patient or the population is on treatment, the likelihood of them taking alcohol, abusing alcohol, it diminishes the efforts that we are making in terms of treatment adherence. So those are some of the areas for collaboration that I think we need to emphasize as we are talking about Drug Master Plan. We need to look at how drug use is impacting on the work that we are doing and how as a collective can we work together in order for us to achieve the objectives as they are set up in our strategic plans. And there are other goals that I'm not going to go to for the sake of time, but I think we are at the point as a country where we need to work collaboratively and ensure that this collaboration effort is not only at national level, but at a very local level, and we start working together. Thank you, Chair.
Thank you very much, and thanks for the panelists for honoring the time. I'm going to move right away to Sanka. Kindly go ahead.
Sorry, Madam Chair, I was just looking for the unmute. Thank you, and we are so grateful to be here at such a esteemed event, to be part of I think a groundbreaking meeting where we can give inputs, and to a great congratulations to the CDA for your annual report. I think it was excellently put together. So thank you from SANCA National side, and a warm welcome and good greetings to all our participants and panel members. I wanted to talk about the demand reduction and goal 1, and really talk a little bit about the services in terms of prevention. And prevention is seen as a science across the world. And therefore, I would encourage us to also look not only at the UTC curriculum from the Colombo Plan, but also the UPC curriculum, which focuses more on prevention services, and that we ensure that it's evidence-based. So from SANCA side, we're very involved with the UPC, and we encourage you to also look at that going forward. Also from a capacity building and a training point, we want to encourage early interventions, and we specifically look here at also SBIRT as an excellent model to use, and that could assist in early identification, screening, but most importantly, to reduce the harms already identified. So that is also something that one can have a look at. I do agree that there's a lack of research in total. I know my time is running out, so we're encouraging the National Household Survey that you suggested in the beginning. We support that to really look at trends and prevalence. If we look at our SANCA stats, we see that alcohol is number 3rd on our list. Number 1 is cannabis, and we have seen a great increase since the cannabis decriminalization happened in the court case. So we have seen that cannabis is taking the lead instead of alcohol at this point. So we have to have a lot of discussions around how we're going to manage the cannabis crisis that we are facing as a country. Then also just to talk about aftercare and how important that is. We call it continued care, and we can't separate it from treatment. There's also the Ripples Aftercare program. That's the National Department of Social Development's program that's got a very excellent impact on our communities and creating peer support groups in communities. Thank you, Madam Chair. There was so much more I could say, but that is from our side. Thank you.
Much appreciated from all the panelists. You're doing well. Facilitator, hard on time. Let me take the higher health representative. I'm sitting with a challenge for 3 other departments remaining because we are left with literally 2 minutes. Kindly go ahead for higher health.
Okay, thank you, Chair. So I'm trying to load my screen, and I hope it's showing from your side. So I'll be brief. We had prepared the presentation to go into detail around what higher health does and where we need some contribution in terms of strengthening alcohol and drug abuse prevention programs. But as we also had an earlier opportunity to engage through our CEO, Professor Ramnik, it's important for us to recognize our beneficiaries, who are primarily people who are between the ages of 15 to 24. It's a big cohort of more than 2.5 million people who are scattered in universities, TVETs, and community education training centers. The challenges that we see go over and above the routine issues that we've been focusing on as an organization, which is TB and HIV, but its interrelatedness to unplanned pregnancies, a topic that has been in discussion today, gender-based violence, mental health, and other non-communicable diseases, but also recognizing that drugs and alcohol present more an accelerant to all of these risk factors for our students. So our response as an entity that represents the Department of Higher Education and Training looks at the 8 pillars, which adds COVID-19 to HIV, COVID-19 to gender-based violence, COVID-19 to substance alcohol abuse. This slide, the aim here was just to show and strengthen some of the, by way of research, to say 60% of college students have reported in a survey that Higher Health ran, have reported use of alcohol or abuse of alcohol on campus. Also importantly, WHO finding of 65% of women who are experiencing GBV, and its linkages to alcohol and substance abuse. I'd like to highlight from our perspective the importance of students' health and wellness programs is that we ensure that students' competencies and graduation comes through the system so they can contribute in the economy. Alcohol and substance abuse has been reported to lower the chances of our students to graduate and fulfill their mission. It's important to understand the people we are talking about. They are prone to experimentation. They are under high stressful environments. They are just coming into being themselves, having access to alcohol. Just looking at some of the drivers or more common substances that are used amongst our youth, alcohol stands out as at about 20% abuse. This is from a recent survey that we ran with the HSRC during COVID-19 times. and so does the use of cigarettes and marijuana. All these put together means that crime and violence, including sexual gender-based violence and intimate partner violence, increases amongst our beneficiaries. Risky behavior, engaging in unprotected sex, unplanned pregnancies, the risk of then contracting HIV and STI, all interrelated with mental health, etc. Risk to disabilities following accidents also then becomes heightened. So
Sincere apology, panel member. We actually have gone beyond our time.
Okay.
So may you kindly round up, and
Yes,
it would mean I'd have to go take it back to the facilitator, even though there are some departments who have not, panelists who have not presented. Thank you so much.
Absolutely, Chair. Just one more minute to say our motto is focused on learn, do, and act. We teach students on prevention through a curriculum, which we highlighted earlier, that would like to engage CDA on for their inputs. After the education on alcohol and drug abuse prevention, they do take a risk assessment questionnaire. So early risk identification, linking into care. Linkage into care is an area that we want to strengthen. We are partnering with SADC on psychosocial support, etc. But it's important to see from our findings that general stress and substance abuse is coming up as number 2 of the reasons that our students are calling in. On this slide, Chair, important again to highlight the need for CDA to assist us with policy development for our sector, to assist us also in reviewing our curriculums and to strengthen the referral system. Thank you.
Thank you very much. Facilitator, we have actually gone beyond our time that was allocated for this session. We have 3 other panelists, even though they were called before and they couldn't come on. So I would like to take the program back to you, facilitator, so that there would be a determination what would be the next move, mindful of the time allocations that we have for the whole program. We had intended to have an opportunity for a Q&A at this point. However, we've already gone beyond time, but the inputs that have been given are valuable. So I'd like to take the program back to our facilitator. Thank you very much. Back to you, facilitator.
Thank you so much, Madam Chair. I think it's very important that we allow SEPs as well as Department of Health to just give us brief input in terms of their contribution. I think it's very important that we do give them an opportunity. I think our questions and answers based on when we reach the end of our session, we'll then be able to determine if we can go in depth and discuss more of the goals. So let's, without wasting any time, let's go over to SEPs or Department of Health if they are ready.
Thank you very much, facilitator. SEPs, may we have a panelist from SEPs to kindly go ahead. SEPs panelist. Whilst we are not having anyone coming on yet, Department of Health. May we have the panelists for Department of Health?
Hello, can you hear me?
Yes, sir. You may go ahead.
All right. Yeah, thank you very much for giving us the opportunity to present. I'll be short. I'm going to present to about objective 1, that is demand reduction through prevention and treatment of drug use, misuse and abuse, which also is aligned to objective number 3, ensuring availability of and access to controlled substances exclusively for medical and scientific purposes while preventing their diversion. For these objectives, what we have done is that the National Department of Health is on the process of developing opioid substitution therapy implementation plan, and also expansion of methadone and buprenorphine to be included in the standard treatment guidelines and essential drug list. I think this is one of the objectives which is contained in the National Drug Master Plan as well as the Health Sector Master Plan. And then objective number 6, strengthening data collection, monitoring, evaluation, and research evidence to achieve the goals the National Department of Health continues to support the South African Medical Research Council through the South African Epidemiology Network on Substance Abuse Project to collect data on trends of substance abuse in the country. We also participate in biannual meetings to get report on the trends. Thank you very much.
Brilliant time. Thanks very much, Ndate Ngako. May I take the subs panelists with the grace period that you are given, subs panelists? Facilitator, there's an opportunity, there's a possibility that our subs panelist is not available because we have checked them several times now. There was also a question from DSD, whether they are not in this particular panel. At this point, I did not identify them on the list, but I take that any other points that DSD might have to factor in might come in the subsequent panels, even though they might also touch on Goal 1 and 2. Let me at this point, thank you most kindly, facilitator, for allowing us that extended time. Let me take the program back to you.
Thank you very much, Chairperson Maboe. I see that we do have some of the entities on our next panel, such as DSD and SAPS, and I think at that point they can touch on the previous goals 1 and 2 that we were discussing. As we are pressed for time, allow me to introduce our next panel, and now we are going to focus on the control of new psychoactive substances and governance, which is goal 3 and 4. It is led by our CDA representative, Advocate A. Johnson, and she also chairs up the Monitoring and Evaluation Committee. Good afternoon, Advocate, once again. Over to you.
Good afternoon, Madam Facilitator, the rest of the CDA executive, board members, panelists, and everyone who's taken the time to share your knowledge with us and join us on this platform. We are going to deal with goals 3 and 4. And before I do, just so that I could get my fellow panel members ready, I will be joined by the following departments and or entities: SANPUD, SAPS, SARS, DSD, and Treasury. In no particular order, I will get to you just so that you're all aware. SANPUD, SAPS, SARS, DSD, and Treasury. So if I may then just take this opportunity, Chair, we have got to look at goals 3 and goals 4. When we look at them, I think it is important to start off with a very specific introduction, which forms part of the National Development Plan 2019-2024. And when we look at the new psychoactive substances, we have a 2017 World Drug Report that notes that there's a growing spectrum of substances. And I'm not sure if it is based on current economic climate across the world, increased joblessness, the COVID issue, but there has been quite a strong move away from traditional drugs. And we have quite an emergence and a variety of new psychoactive substances. It's a growing international threat, but for us all to take note that South Africa is not immune to the globalized nature of the illegal drug trade and the new psychoactive substances. In terms of goal 3, goal 3 requires of us to increase the availability of and access to controlled substances exclusively for medical and scientific purposes while preventing their diversion. And if I may just pause here, Madam Facilitator, I think sometimes we do get lost when we look at substances and controlled substances, and we forget that over and beyond the substance itself, we need to look at what drives the use thereof, the abuse thereof, especially with our medical controlled substances. And I think we should be mindful that, the stress of COVID-19 lockdown, loss of jobs, loss of income, really has exacerbated the use of controlled substances. And the goal of, or the aim of Goal 3, we are to increase the number of patients receiving appropriate treatment for medical conditions requiring the use of a specific medication while controlling the misuse and diversion of these substances. Because we have had quite an abuse of controlled substances, especially in terms of medication, because people have not been able to deal with their issues. And part of what we look at then under Goal 3 would be us providing an effective supply chain for controlled substances for legitimate purposes, reducing the non-medical use and misuse of drugs, and to prevent their diversion, misuse, and trafficking. And also for us to consider strengthening the regulation of the cultivation, production, possession, manufacturing, storage, trade, and distribution of drugs for medical, scientific, and research purposes. Because what we have seen is that due to COVID and lockdown, people have become more creative, and we've had more drugs that have become more accessible, albeit on the illegal trade. In terms of Goal 4, we need to identify and control new psychoactive substances. And we need to be mindful that we must share information more readily. We should have more early warning networks. We should develop appropriate national legislative, preventative, and treatment models, and supported by scientific-based evidence, because we need to consider the most prevalent, persistent, and harmful use of these new psychoactive substances. So we do have a growing threat in Europe and in the States. I said South Africa is not immune. South Africa as well, more so in terms of our ports of entry at OR Tambo and Cape Town International, through the ports of Mozambique and Botswana, we have an increased trade in psychoactive substances. So ordinarily, much of the preventative measures, colleagues, would be in terms of Goal 1 and 2, in terms of investigations and prosecutions. But I think there's more to be said and to be had, and I'm going to then ask the panelists in no particular order. If we have the panelist from Sanford, if you would introduce yourself, and we, like the previous session, are all pressed for time. So if you just give us a brief introduction to what your institution does. And if you have any of you prepared a presentation, what I will ask is if you will provide those presentations through to the facilitators so that we have all your presentations, so that we take note of them. So even if you cannot get through a presentation, you at the very least have given us your input. And Sanford, when you do your introduction, perhaps one thing I would ask that you consider is the following question. How do we dispel the myth that not all drug users are addicts, or that certain drug use can be legitimated? Because I think in the times that we currently operate under, that is a very important question. Sanford, introduce yourself and thank you for your presence.
Thank you for including Sanford. We really appreciate it. My name is Sean Shelley. I'm the former Deputy Secretary of the Vienna NGO Committee on Narcotic Drugs for the United Nations. I work at the University of Pretoria and TB/HIV Care, and I'm the chairperson of SANPUT, which is an organization that represents the rights and interests of people who use drugs in South Africa, looking at effective interventions and health interventions for them, specifically in the HIV sector, but also in the social sector as well, with a focus on integrating people so that they don't suffer unduly and are able to resolve their drug use issues more easily. So if we look at Goal 3 and 4, from a SANPUT perspective, we believe that both of these are important goals. There seems to be a lack of clarity around what a new psychoactive substance is. Of course, just because the word new is there doesn't mean it has to be new, but we believe that this is a very important category of drugs that we're seeing. For example, a synthetic cannabinoid is not related to the cannabis plant in any way, and has significant dangers and harms. What we've seen internationally with the trends is that these substances actually try to get around the legal regulations that are in place and the scheduling of drugs by the UN to invent new drugs that are constantly changing, that are untested and unknown. Fortunately, in South Africa, we don't have that same level of problem because our laws are more general, but obviously we are not immune to new psychoactive substances. Specifically, we would be on the lookout for things like the fentanyls coming into the country and the synthetic cannabinoids as well, which are particularly harmful. And we've got a lot of drugs coming into the country, such as the methamphetamines, the amphetamine type stimulants as well. We would like to see a more holistic approach to this control and not just a reliance on the criminal justice system. Often we pass off our social problems onto law enforcement, and we know that only a fraction of the drugs that enter the country can possibly be stopped at the borders, and we need a much wider range of interventions to control for these substances, specifically looking at precursor chemicals as well. But most importantly, we believe that the solutions to these problems are social solutions alongside the solutions that address things like transnational organized crime, who obviously get great financial benefit out of the massive margins that are available in the drug market. I'm not going to say anything more than that at the moment. I'll leave it there, but welcome any questions in the chat section or afterwards as well.
Thank you ever so much, Sean, for that insight and input. And thank you that you were prepared to come onto this forum. If I could then move on to, do we have a panelist from SARS, the South African Revenue Services? Are you available? Is the panelist from Treasury available? And colleagues, I'm not being rude by asking for a person from a department. We were not given the details before the time, so I call you out by your department. Treasury, are you on this platform? No? Department Social Development, are you on the platform? If you are, can we please have your introduction and your interaction? Yes. And I think one question that I would like DSD to just inform us on is, apart from giving us a very brief introduction, is perhaps DSD to indicate whether our programs actually look at the relationship between drugs and gangs, because that is quite a high impact issue across the board and affects how we deal with things socially, economically, as well as in the criminal justice system. I'm all yours, DSD.
Okay. Am I audible, Chair? Hello?
DSD, you are audible. You can continue.
Yes, okay. Thank you very much for the opportunity, and good day, everyone, and protocol observe. Yes, Chair, I'm aware that we are under serious pressure in terms of time, but let me quickly clarify that we do not contribute to the following goals, goal 5 and 6. We're actually in goal. No, we don't contribute to goal 2 and 3. We contribute to goal 1, 5, and 6. But in the interest of time, I'll just focus on goal 1. And then I'll answer your question. Just on goal 1, Chair, it's about demand and harm reduction. We are contributing in terms of the harm and demand reduction, in terms of the level of services that we provide. There are about 3 levels. The first one for us is a prevention one, which focuses around education and awareness. And we are specifically targeting youth. We are not targeting everyone, but our target group is the youth, because the literature has indicated to us that young people are the ones that are more addicted to substances and are more affected than any other population. So therefore, that is our target group. And we've got a lot of school-based programs. One of them is Kimoja, The second one, we have an integrated anti-substance abuse program targeting post-school spaces. This is linked to the question that you've just raised of saying, how do we link substance abuse and gangsterism? We have an integrated program that is addressing bullying, anti-gangsterism, and substance abuse. We do it in about 30 universities as well as TVET colleges. It's an integrated program where we intervene in terms of those levels and make sure that we highlight the dangers of the tattoos, the dangers of the group of anti-gangsterism, and how it leads to drugs, because drugs is part of their culture and so on. It's a comprehensive program that needs time, but all I can say is that we are very much aware of those dependencies, and we have a program that is linked to address those dependencies. The second issue is early intervention, Madam Chair. In terms of the early intervention, this is also important because we are saying as much as our focus must be on prevention. In an event where for some reason you could not reach out to everyone, people find themselves, in experimenting, it's quite important that we intervene. So we do have programs that address in early intervention services, like we target specifically hotspot areas where we go and really do brief intervention, as well as Sialulama programs. Those are some of the programs that we do that are linked to treatment center. The third one is it contributes to harm reduction, which is the treatment services that we have. Treatment services, we have services for our SUD clients. We are using the universal treatment curriculum, which is linked to Colombo. It has a plus minus about 6 models that we are using. We're not using one size fits all, but we've got different types of models that we are using in dealing with that program. We also emphasize on family therapy because we understand that the presenting problem might be that individual, but the problem is much bigger than any individual. So we do have that for our treatment program. And that's where we also link with HIV programs, because there are a lot of comorbidities that we are also addressing through our treatment program. The last one is aftercare services and reintegration. So we are saying it does not end with treatment. After treatment, then what? How do you sustain? How to ensure that at the end of the day, there is sustainability and people do not relapse? So we do have aftercare and reintegration programs, but I must say, Madam Chair, that those programs are not everywhere, and we need to really strengthen them and make sure that they are fully funded, because at this stage there's partial funding around them. Our emphasis, our budget, it's around treatment. 90% of our budget goes to treatment and 10 goes to aftercare, which is a bit of a challenge. So we want to shift and make sure that all the all levels of interventions, they are covered. Then the last part that we also contribute in terms of this goal is legislation and policies. We are saying legislation and policy reforms are part of a strategy to reduce alcohol, and they contribute to prevention. So we do not see it separate. It is important that everyone in the sector that is affected by issues of alcohol and drug abuse must review and ensure that their legislation are approved, because through those measures, we are able to prevent. I thank you, Chair. Thanks.
Thank you very much, Mayor. Can I then check, and Madam Facilitator, if you will assist me as well as Lerato, if I cannot see, because I quickly browsed through the chats. I cannot see SEPs. Do we still not have a member of the South African Police Services to just give us a brief introduction of what they do? Although I do know what you do, it becomes important for others on this platform that you share that. Are you not on the platform? Okay. I take silence meaning no. South African Revenue Services. Are you not on the platform? I did see, Madam Facilitator, a comment earlier from the person from SARS, where the person indicated that they didn't like the use of this platform because it is not as secure a platform, and that he suggested 2 other platforms, but we had to be mindful, and if I may respond, is we have to use a platform that is user-friendly for the majority, especially in terms of cost and accessibility. and the Zoom platform was the most viable option for this interaction. The other two programs, the MS Teams, for example, have license issues and are mainly used by us government departments. So that is an issue. Oh, I see Dr. Atalia says Colonel Matlamela from the police is struggling to connect. So that means we don't have SEPs. Lastly, going once, twice, and for the very last time, Treasury, are you here? Everyone on this platform will need you because we need your money. We need to know that you are prepared to give us more money. We need to know that you are prepared to give us more funding, especially for treatment programs, and especially those run by the NGOs, because these treatment programs, Madam Facilitator, have become more exclusive as opposed to inclusive, because the cost implications to individuals and families is beyond bearable. People are barely able to make ends meet. And it would have been nice to hear from Treasury if they have other initiatives in place over and beyond funding government departments and asking us out of that limited budget to also be able to assist, especially in treatment action programs and treatment action centers. But I see there is, okay, I see Lerato. Thank you, Mayor. She says Treasury is also not available. So Madam Facilitator, thank you for this opportunity. I think what becomes very clear is going forward that these are not to be dealt with as just interactions, because it becomes important for those who join this platform to be given the full scope of what is out there, what they can engage with, what those challenges are. And perhaps there are, and I've seen from the chats, very knowledgeable and experienced persons who would perhaps have been able to interact and give us suggestions on some of the issues raised. But be that as it may, thank you very much, Madam Facilitator, for your time. That does it then for goal 3 and 4. Thank you.
Thank you very much, Advocate Johnson. Here we are rushing through without wasting any time, just so that we can have time at the end and then we can see what we can cover, which speaks and sustainable economic growth. Thank you so much, Professor. Over to you.
Thank you, Madam Facilitator. I hope I'm audible. I'll move. If
yes,
I can
you
just
are.
Get an indication. Thank you very much. Good afternoon to you, to the Chairperson of the Central Drug Authority, my fellow panelists, and the esteemed guests. The process that we are now embarking on is going to be quite crucial for us as the Central Drug Authority, as is leading us towards planning on how we're going to further engage you as the stakeholder. It is therefore quite profound that we had this opportunity, and we are very well aware that it's not all the stakeholders that are able to come through to this platform, but at least this affords us as the Central Drug Authority an opportunity to once more know exactly what are the areas that we need to go and focus on as we build towards a plan. South Africa does not have, as you all know, an updated data on substance abuse. Accordingly, the last household survey was conducted in 1996. That's quite a time ago. However, DSD, the Department of Social Development, did conduct a survey or a snapshot around 2010, 2011, which snapshot really led to the second biennial substance abuse summit, some of whom some members of this panel and the audience did attend in 2011. It has therefore become urgent and critical for the Central Drug Authority and its stakeholder to develop what is called a national research agenda for the substance use in the country and a full national survey in order to capture trends and patterns of substance abuse in the country. The CDA continues Central Drug Authority, continue to seek the best of the latest credible, published, peer-reviewed research to understand the trends, to identify any challenges, and to obtain guidance in achieving the set objectives and serving the community. Substance abuse undoubtedly fuels crime, it fuels poverty, reduced productivity, unemployment, dysfunctional families, life, political instability, escalation of chronic diseases such as HIV and AIDS, TB, as well as premature death and injuries. So strengthening the knowledge base on the drug problem by improving data collection, analysis and dissemination, including on the links between drugs, crime, gender-based violence, and femicide, HIV, AIDS, TB, STI is critical to an effective South African response. The contract that the government through Department of Social Development has with the SMRC, that is through Sakendo, for the data collection, analysis, and compilation of the report on the trends of substance use and abuse, serves as the country's national drug use surveillance network and is well supported by the Central Drug Authority. The CDA, through the Social Development Department, has a national clearinghouse that is a small library or a repository of data on substance abuse that will enable the CDA to collect, assess, store, and distribute books, documents, and information that can be used by interested parties and accessed physically or electronically. Invariably, its existence is not well known, and the extent of its utilization has not been determined. With that, ladies and gentlemen, I just want to introduce the fellow panelists, some of whom will focus on the issue of the National Research Agenda, the issue around their collection and their recording of data that relates to substances, and they will also share with us how they conduct their baseline surveys or their rapid assessments on drug use, how they maintain and establish the information systems, and economic development activities that they participate in within the substance abuse and use, and of course, the social reintegration and aftercare programs that they run, and of course, what their views are going to be in relation to the biannual summit, which in the main would have to focus on the sustainable economic growth, unemployment, and inequality. The panelists are made up of the following, give an indication as soon as their organization has been mentioned, so they can at least take the podium. The South African Medical Research Council, I think they are represented. The NYDA, the Department of Social Development, the DTIC, the Department of Employment and Labor, and DGMT. Madam Facilitator, in the interest of time, I'm just going to ask if SMRC is, I know that I saw Dr. Nadine Haka, a very good friend of the Central Drug Authority, and may I request that she gives an input as well. Dr. Naga, can you please take the podium? It's Nadine, sorry.
Good afternoon, Professor Palmer. Sorry, I lost connection there for a minute or two. Greetings to everybody, all the participants, all the esteemed leaders that's attending this meeting or the stakeholder meeting. I'll just give a summary of what the SAMRC does, and more specifically the Alcohol, Tobacco and Other Drug Research Unit, which I am from. I think perhaps of importance is to note that the Alcohol, Tobacco and Other Drug Research Unit has been around for at least 30 years. And over these 30 years, we have been involved in a lot of research work ranging from understanding the extent of alcohol, tobacco and other drug use in South Africa, looking at consequences, looking at changing of trends over time, identifying high-risk groups, looking at risk and protective factors, designing and evaluating interventions across the spectrum, and making inputs into that at a policy level, evaluating interventions, and also supporting advocacy efforts and sharing of knowledge with policymakers, service providers, and community representatives. And we are constantly putting out policy memos around substance use within our country. What has been mentioned quite a bit is Sekendo. I am the national head for Sekendo, which was established in 1996 and looks at, it's a community epidemiology network that comprises researchers, practitioners, and policymakers from all over South Africa. And we meet every 6 months to provide public health surveillance of alcohol, tobacco, and other drug use. Of course, trends and the presentations and discussions take the form of quantitative and qualitative perspectives and not only one-sided, and we often invite researchers to present on their findings. Over the last couple of years, Sekendo was initially just around treatment demand data, but we've now collaborated extensively with other organizations in South Africa, such as TB, HIV care, ANAVA, etc., to collect data on community-based harm reduction services that are operating throughout our country, so that we have a clearer perspective of a holistic perspective of substance use trends in our country. I can point out, yes, the absence of a household survey. It's something that we as the SAMRC have been advocating for years, as well as the need for a youth risk behavior survey as well to run parallelly. I think we run behind our other national countries, such as Nigeria and Kenya. We do need a better data repository, and our intention is to develop Sekendo into becoming such a repository over the next 10 years. We are also have evaluated a lot of interventions, be it at the prevention level or at the treatment aftercare level, and we are open always to collaborating and discussing possible interventions that can be piloted or implemented. Yeah, so I think just for the sake of time, I can go on forever, but I will pause there. Thank you, Prof.
Oh, sorry, I was muted. Thank you very much, Nadine. It's quite refreshing. Sekendo, for the sake of benefit, is that it's one of our flagship, and I think very soon we will start hearing about the Wendu, which is the west of Africa, the east, because we have set up the tone at the AU Commission, as well as South Africa is leading in terms of the epidemiology network. May I then ask the NYDA, I see I got a name here, Nontsikelelo. I'm not sure, Nontsikelelo, if you're already on the platform, if you can also give an input from the NYDA point of view. Nontsikelelo, or any representative delegated to speak on the NYDA, please. Thank you.
Professor, may I suggest that we move to our next speaker, as nothing has been prepared from NYDA. They weren't aware. So let us move on to the next speaker.
Okay, that's great. Thanks, facilitator. The Department of Social Development, I know that you gave an input on the previous goals. May I request that you are able to come through the platform and give us an indication from your side as well on the two goals, the three goals, 5, 6, and 7. Social development, anybody who is delegated to speak on those 3 goals, please.
Chair, in the interest of time, I would just, like to mention that we are involved in Goal 5 in terms of, supporting the coordination both at national level as well as provincial level and local space, even though those are some of the areas that would like the new CDA to look at and ensure that we really strengthen the provincial and the local space, because some of the structures that are there are not well funded and well resourced, and therefore it becomes difficult for them to generate reports. It becomes difficult for them to ensure the implementation of the National Drug Master Plan. And we know that implementation happens at that level. So if that level is not properly resourced, it's going to be difficult for people at a higher level to receive reports and so on. So we do are involved in that space, but we would just say as one of the areas would like CDA to really look at that as they are going through their strat plan to ensure that that area is well covered. The other goal that we are involved or contributing to is goal 6, that speaks to the research. Yes, of course, you did indicate, I think, in your preamble that we fund partly the Medical Research Council to collect data for us, because at this stage we are really struggling when it comes to data. We don't have data at a click of a button in terms of what is happening in the country, and as well as the treatment centers, or even for that matter the programs that we are currently funding. So it is an area that needs serious attention, and it needs a lot of resource, because research is expensive and it becomes difficult. It becomes the last part of our budget to really, fund this and make sure that data is available. We don't prioritize it, and yet it is important. I think those are some of the things that we need to take forward and make sure that it becomes doable and it becomes affordable. One of the challenges that makes it difficult for us to fund it adequately is because of the high costs that are involved. But we are saying there are other measures that we can explore, like maybe identifying universities in our respective areas and start forming collaboration with them so that they can assist and do and take some of these research activities. I think you should let me pause there. Thank you.
Thank you, Social Development. I've got a question for you, and I hope we can have just a small conversation around it. What is it that we are doing? What is it that we are doing as government to stimulate a robust and sustainable economic growth, which is aimed at reducing poverty, unemployment, and inequalities? It is one thing to have people just abusing drugs and being users, but what are the economic opportunities and growth opportunities that are there for the young people and the women so they can participate actively in that space? Other than, I'm trying to look at it not as a in a departmental level, but more as at a government level or as a broad level. Is there anything that we should be doing in that regard, social development, whilst you're on the podium?
Okay, thanks, Chair. Even though we are not leading in that area, economic department or clusters are the ones that are leading. However, we do contribute one way or the other in terms of the services that we are providing. When I zoom into substance abuse, maybe space, one can say, we've been talking about skills development, linking the treatment centers with skills development as well as the aftercare, because that's where economic opportunities can be built in there. We are saying when a person goes through a treatment program, for be it short-term or long-term, our focus should not only be on the substance itself, like, going through the whole treatment program psychologically, physically, and so on. But we also need to look at what type of skills does this person have. If not, our programs, are they responding to that? Are we building the skills development part that will enable this person, when she's released or he is released from the treatment center, then he can be able to participate. We're even saying or proposing that not only it be a program, but we must link them with job opportunities, learnerships. We have relationships with health and welfare sector to look at those opportunities. So there's quite a lot of investment and reforms around that space to make sure that we link skills development to the treatment center as the first part. Then the second part, Chair, is the aftercare services. I think I've alluded to that earlier on to say our aftercare services are quite limited, and we are not spending time on that. We need to strengthen them and make sure that they don't only talk about the emotional issues, but a person must be empowered with more skills. So we are looking at that. There are a number of service providers that have approached us. They came up with brilliant, innovative ideas. So it's for us to open ourselves more and sit down with them and say, how do we massify and scale up what they are doing with the cooperation of the provinces, of course, because we are not at our national level, we don't implement, we just come up with strategies. Provinces have to ensure that they implement. So we need their buy-in and to make sure that we take the process forward. So I would say that is a very critical issue, but we are not the lead. It is led by Economic Cluster, and they happen to be part of the CDA. So we are looking forward to that they should lead us and for us to contribute to the bigger picture. Thank you, Chair.
Thank you very much. The next input we can expect from the DTIC, if they are on the platform. DTIC, can you please give us an input? If they are not on the platform, I will move them to DGMT, so they can also give us an input before I throw a question back to Nadine on a different area. DGMT, are you on the platform? And if so, please give us an input. You just had a successful alcohol conference, and I'm sure that will come handy quite now, given the fact that there's already a recommendation that came through for the bill on liquor amendment to go through Parliament. DGMT, are you on the platform? I don't have the name, unfortunately, but if you are on the platform, please give us an input, or DTIC. I know that McDonald Nechitenze is going to have to speak on the DTIC, so he's still just trying to work out the technical glitches. In the meantime, Dr. Nadine, if you're still able to hear me, can you just please indicate if we were to convene, because the last summit, biennial summit, was convened in 2011. If we were to convene a biannual summit now as the 4th Central Drug Authority, what would be the areas that you would suggest we look at, upon which we need to resolve, so we can take it in our planning next week? Nadine, whilst I'm waiting for McDonald to connect. Dr. Nadine?
Hi, Palmas. I think one of the areas that we would definitely have to deliberate a little bit more on is just around prevention of substance use in general through all life trajectories. I think there's still a little bit of a misunderstanding around what constitutes prevention. And Audrey Vermeulen spoke about Colombo Plan and the UPC, etc. So that is something to be considered, especially also around capacity building for prevention, and then also minimum norms and standards for prevention practices, because at the moment they are very fluid. If I can mention that. The other is also addressing, if I can put it this way, the controversy around harm reduction. In South Africa, harm reduction services, to debunk, I think, all the myths. There's some discussion that is needed around that and how to integrate it. Then, of course, I think also around aftercare, and which has been mentioned throughout this stakeholder meeting, and where that fits in and why it's important, etc. Capacity building of our staff, consistently so. Those that provide services, I think some of the training is still once off. And there is insufficient, the substance abuse field or the substance use field, it goes through many changes so quickly. And we need to make sure that there is continuous capacity development for various levels of care. That is something. And then also accessibility. Accessibility is still accessibility to treatment, accessibility to early intervention at all levels also is something perhaps that should be flagged. And that's just off the top of my head right now. And then the last thing is research. Researchers and practitioners are still working largely in silos. Lack of integration or collaboration between the two, except of course for Sekendo, which is my baby. But I think there can be better efforts at looking at interventions, and research can contribute to monitoring and evaluation components. And I take on board the suggestions made by CESA around academic organizations participating, be it masters, etc. So some discussion around that as well. Thanks, Palmas.
Thanks, Nadine. I noticed that Onesizwe T from DGMT is struggling to connect either the microphone and both Nechitenze from DTIC. If you're able to connect, you can talk. In the meantime, then I'll just ask DPME as another input from them, the Department of Monitoring and Evaluation. They've been quite generous in the previous administration of the Central Drug Authority to do an evaluation for CDA on the National Drug Master Plan, which assisted in the development of the current plan. And I'm not sure that they're also on the podium, so they can just give us some indication of how do they feel about the current National Drug Master Plan as opposed to the previous one. DPME, if you're on the podium, you're welcome to comment, or any of the people that were earlier on mentioned and they were just having some technical glitches.
Hi, Chair. Can you hear me? Onesisa
Yes,
from.
Please proceed.
I'm now enabled. Sure. I think just to be brief, Chair, as you mentioned, we recently had an alcohol harms reduction workshop. We've done a very comprehensive study, a legislative review, and consolidation of evidence on both upstream and downstream drivers of particularly alcohol-related harm, and we found some key evidence points that support the ban of advertising and how much more likely adolescents are to drink when they're exposed to advertising platforms. And this study also revealed how the tobacco ban had resulted in a significant reduction in South Africa from between 1993 and 2010, and how price sensitive heavy drinkers are, and the different levels of elasticity that range between binge drinkers and heavy drinkers really indicate how important pricing mechanisms are, and also critical, particularly for availability to be reduced. I think even our COVID work has illustrated this, and lastly, then how important access to treatment centers is, and how important it is for those services to have community-based interventions that are linked to those interventions. And the critical thing that we have also found is how there isn't very strong information building mechanisms across the sector, and how much of that, even within government, there are different levels of adopting the varying types of evidence. And it's really critical for the state to really pay attention to independent research and research institutes that are really providing, cutting edge information on how policy can really be amended and transformed to tackle structural issues. A lot of substance abuse issues are in fact more structural than they are behavioral. And I'm very glad to see that the DTIC is really starting to move on the Liquor Amendment Bill, because that bill really addresses the structural issues and the evidence is there. SAMRC, like Nadine has illustrated, has done groundbreaking work that we also partner with them on. We've commissioned independent research from UCT and the University of Sheffield in Scotland. So there is evidence that both the CDA, DSD, and the DTI can really move on across the spectrum of causes that are related to substance abuse, and in our case, particularly alcohol harms, but some of it is really applicable across multiple substances. So it's really important that the CDA also takes a view that is both structural and behavioral, and addresses and looks at approaches that have really strong international benchmarks, and really harnesses some of the key things that are coming out in these groups, but also the resources that us as independent groups have to strengthen the research and evidence base for the National Drug Master Plan. Thank you.
Sorry, I was muted. Thank you very much.
Hello.
Hello, can
Hello.
you? Yeah, thank you very much. I'm going to this moment allow the representative from the DTIC, Mr. McDonald Nechitenze, who's also going to talk to us about the old issues around licensing of liquor stores closer to schools and places of worship, perhaps. Mr. Nechitenze, you are now connected, then you are going to be our last speaker on last panelist to give an input on the matter. And we're just slightly now running out of time. If I can just hand back to you, Mr. Nechitenze McDonald. Thank you. You can take over.
No, thanks a lot. And thanks to the chairperson of CDA and the colleagues. I take the outcry that the amendment of the liquor bill should move to cabinet and to parliament. I take that as a compliment to the DTIC. And then I'm affirming or ensuring people that the bill is in the process of going to cabinet. There were some little research that we are doing in order to enhance the bill. We were doing a research on advertisement, how these role models that are being used to lure or to attract the youth, how can we curb them? And then the issue of pricing units is also being considered. I heard somebody, is it from SAPS, talking about the binge drinking, addressing that issue. It is catered for in that research to enhance the bill. We also have what we call traceability of legal as well as illegal liquor, because what happens is that we may be saying there is a lot of illegal liquor in the market, whereas they are legal. Take an example of Macro. Macro sells even to people whom you don't know whether they are buying in order to go and sell or is for consumption only. So we have the issue of tracing issue to say, are you going to resell the liquor? The wholesalers, not Macro, others, are they supplying illegal shebeens, taverns, and the like? We should be able to trace that, and probably the SARS people should also, for tax purposes, be able to trace such. So we were doing a research on that in order to complement the bill. The other issue is the age 21. I think we have ventilated a lot on this matter, and then it needs to be in the bill. And then the issue of outlets that are next to Soshanguve, I had the education person saying in Soshanguve that UT at the gates, the students have free access to such. So the issue of licensing outlets is with the provincial boards, but they are demanding or they are requesting it to be in the national legislation. So there is a discussion between the departments. Mind you, liquor is of two competencies. We have manufacturing, we have wholesalers that are in the national department, and then outlets, retail, at a Pick and Pay and Tops. These are provincial competencies, and therefore we are conniving with each other in this regard. So therefore these matters are concluded probably in the second quarter. We will be reporting to you, that is CDA, and then we will be reporting whether the bill is being taken to cabinet. But all this buffet of issues are with us, and then they are in the process of being attended to. So this thing that is coming is just a question maybe for academic purposes. The issue of lockdowns, when there is lockdown, say 5, 4 level, and then there is no sale of liquor, it seems as if there is an
Can I ask you to conclude?
Hello?
Sorry, but I'm just asking you to conclude because we have horribly run out of time now.
Yeah. Yes, I'm concluding now. To say these lockdowns, say 5, 4 levels, you find that there is no sale of liquor and there is no binge drinking. So the issue is, are we dealing with the issue of curbing the liquor abuse? Can we do it in a more structured way, or should we live with this issue of lockdowns, say level 5 and level 4? It's just an academic argument that I'm introducing. Others are saying it is working very well. So, but from our side, we are saying let's have a structured discussion. Thanks.
Thank you very much to you and to all other fellow panelists for the insightful input that you gave. We will be able to take some of these inputs really into our planning session as the Central Drug Authority. And with that, I want to hand over back to you, facilitator. Thank you.
Thank you so much, Professor Mashebela. Although we would want to engage our stakeholders further on this very important matter, I wouldn't want to take away anything and take away time from our chairperson, whom I'm sure has so much input, and we have limited time. So let me also just say goodbye and thank you to everyone as I hand over to our chairperson. Thank you for your input towards moving our country from a culture of addiction to a culture of wellness and recovery. From me, Dirleen James, your facilitator, over to you, Chairperson, to do our closing remarks. Thank you very much.
Thank you very much to the facilitator, Ms. Dirleen James. I think that you've really done an excellent job in facilitating this session. I think it was a very, very successful session. Firstly, we would really like to conclude and perhaps just go through a summary. I have been listening attentively, hence I couldn't participate. I've been listening with the aim of developing a summary and conclusion of the session that we have just held. So firstly, I'd like to acknowledge all the valuable information that has emerged from this stakeholder engagement. We are so grateful as the Central Drug Authority to have engaged with all of you. You have actually made CDA's annual performance planning very easy because it will incorporate most, if not all, the valuable recommendations that have been made at this engagement so that we emerge with a holistic plan as CDA that incorporates all the information that you've given to us. By the way, we are going to have this strategic planning workshop as the CDA on the 29th of September, 29th to the 30th of September. And I want to reassure you that we will take a report from this session, present it at that strategic planning session so that we can incorporate this valuable information into our annual performance plan for 2022. So also because one of the CDA's powers and duties is actually to review the National Drug Master Plan every 5 years. Your input will help us to do this in collaboration with all of you and other stakeholders. So we would like to request all the speakers from today's engagement to really forward your presentations to the CDA Secretariat. And I'm going to ask Lerato to actually post the email address where all the presentations that were made today can be emailed to. So just a summary of the discussions. I've been taking notes from the panel leaders, from the speakers and from the panelists, but also looking at the chat group as to what you as our stakeholders and participants are saying to the CDA. So just a few summary points are that one, from the presentation of the annual report by the Governance Committee Chairperson, we want to express our appreciation that almost all of you, listening to you, looking at the chat group, you've welcomed this annual report and you have appreciated the input. And really as CDA, we are encouraged. Remember, this is our first annual report writing, also reporting on work that we did not do. We're reporting on work that was done by the third CDA, and we really appreciate you welcoming this report. We have also noted the shortcomings and that we are prepared to address all the shortcomings that you have raised in this engagement. Remember, Dr. Guru put it so well to say that organizations grow and develop on analyzing shortcomings of the past and ensuring that these are not repeated. And we definitely commit to do exactly that. So we are committed, therefore, to analyze and address all the shortcomings and where possible, because when we started, I did indicate that this annual report is still in a draft form. The minister and the deputy minister are considering it as we speak, and perhaps there will be that window to then input into the annual report where possible, to ensure that we have included in the issues that you have been saying are missing in the report. Where possible, please, if it's not done, it means that it would have been possible to do that. So we've also noted that some reports from the provinces are not included, and that provinces are also saying, even departments are saying that some goals are not reported on. We also need to realize that organizations, stakeholders, departments, and provinces do not necessarily have to implement all the goals, report on all the goals, because you may not have a mandate or a responsibility on some of the goals. So I think it's normal not to have all the goals reported on. So the second matter that I would like to raise is that some of you have said that it's difficult to switch from implementing the 3 goals of the previous National Drug Master Plan to the current 7 goals of the 2019-2024 National Drug Master Plan. So the recommendation that has come out of this engagement is that the CDA should coordinate a national capacity building program and training program with all the stakeholders that we have today, but also go beyond the stakeholders in today's engagement. But I wish to indicate that CDA had already started, supported by the Secretariat, to undertake capacity building, but we welcome the point that it should be a national capacity building program. We should also include the politicians, you know, the mayors who are actually responsible for establishment of the local drug action committees, the MECs who are responsible for the establishment of the provincial forums that actually do this work. The third area that I would want to summarize is the fact that CDA is looking at the effect. CDA must look at the effectiveness of interventions and the return on investment for all the interventions that all the stakeholders are actually carrying out. I think an example was cited that there's little data that support traditional inpatient rehab, which is ineffective and expensive when compared with the community embedded services, but also that there is lack of substance abuse services in the rural areas in particular. So the CDA would have to ensure that the work that is done not only in the urban areas, but that it's done in the rural areas as well. And there was a recommendation that CDA must ensure that we improve our monitoring and evaluation system. And I'm happy that one of the committees of CDA is monitoring and evaluation committee led by Advocate Andrea. And I think you've heard her speak later in this engagement, earlier in this engagement. You have made recommendations specifically for CDA to work with the entities that are coordinating the implementation of the National Drug Master Plan and civil society. A point has been made that there could be unfunded mandates. Stakeholders are saying this is an unfunded mandate, but I think there's a specific recommendation that came across to say that at the planning stage, all the provinces, all the departments, all the civil society organizations should be able to have a budget specifically for addressing substance abuse in our country. In fact, there should be key performance indicators in all the plans of the stakeholders right at the beginning of each financial year, so that we are sure that there is funding for all of us to carry out this work. But I think there was also a recommendation on a special fund that should be created to ensure that this work that we do to implement the National Drug Master Plan is funded, and that there is no excuse for stakeholders to implement what they're expected to implement. There was a specific recommendation also to cooperate with institutions of higher learning who are undertaking youth studies regarding alcohol and other pandemics. We are as CDA encouraged by their willingness as well to work with the CDA on research and policy development, especially on the sale of alcohol and substance abuse in our country. So we welcome the recommendations for CDA to play a role also in making an input on the curriculum of higher institutions regarding addressing substance abuse and other pandemics. We were told that in institutions of higher learning, substance abuse is rife, and that we need to work together for CDA also to consider, reviewing, working with the institutions of higher learning to review the curriculum, so that the curriculum also addresses these social issues that we are experiencing. There was a recommendation that we need to ensure that all stakeholders who are responsible for implementing the goals of the National Drug Master Plan, especially where there's very little that has been done over the year under review, that they get supported to implement their part of the National Drug Master Plan. In particular, there was a recommendation that says we need to strengthen the local drug action committees so that they also get specific toolkits to conduct situational analysis, their environmental scans where they are, to recruit members, to design interventions, and to evaluate their strategies. And that we need to ensure that the LDEX and even the provincial substance abuse forums are empowered and they are supported to do their work. Because this work needs to be done on the ground. And for them to be able to succeed, we need to support them. There was a specific recommendation that CDA needs to ensure that this work finds its expression in the district development model, so that this work is communicated with all stakeholders, especially to address the social ramifications. Another recommendation was that we need to collaborate. There must be a collaboration between social development department in particular and the health department, because they are responsible mostly for goal 1, goal 2, and other goals, but specifically on ensuring that there's access to substance use facilities, especially in the rural areas, through existing community structures. So those are the recommendations that really came from the discussion of the annual report that the CDA has actually prepared. We then had a discussion, panel discussion, 3 panel discussions. The first panel was looking at goal 1 and goal 2, mainly looking at reduction of supply of drugs, as well as reduction of harm. So panel number 2 was then looking at goal 3 and goal 4. Panel number 3 was looking at goal 5, 6, and 7. But just to summarize, not going through panels each in 10, just to summarize, I think the observation from the CDA is that various stakeholders who participated in these panels already are doing a lot of work in implementing the National Drug Master Plan goals that apply to their mandates, of course, and focusing on programs of prevention, early intervention, treatment to reduce harm, aftercare programs, reintegration into communities, including the support groups. And we really, as CDA, would like to express our appreciation to all of you stakeholders who are hard at work implementing the National Drug Master Plan. And we also appreciate the work you do, in particular with the young people in our country, because they are the most affected by the substance abuse and substance misuse, as well as the substance use disorders. The other observation from the panel discussion is that the country has a number of national plans to address various pandemics and social ills. And that therefore there's a need to ensure that we find a way to link all these plans, and I'm talking about plans such as the NSP GBV, the SANAC plans, the cannabis master plans, and many other plans that are there that are actually addressing the same issues. And remember, we are all working with the same audience, or working with the same people in our country on the ground, and therefore coordination, integration of the work that you do is critical. The last issue that seems to be a hot potato also is the issue of alcohol. When we say substance abuse, we include alcohol abuse, but I think we now picking up the alcohol problem in our country, especially during COVID-19 period. The problem of binge drinking, which seems to be one of the biggest challenges in our country, and therefore the recommendation for stronger regulation environment. We are encouraged, especially by the last speaker, Advocate Nechitenza, who has informed us that there is progress in moving the liquor amendment bill forward to the cabinet and to parliament. And we appreciate also the involvement of the ministers who will ensure that this liquor amendment bill is passed by parliament. So thank you very much. So in closing, I would like to really thank, firstly, the deputy chair of the CDA, because she has been hard at work putting together this stakeholder engagement, assisted by the secretariat, assisted by one of our committees, the communications and marketing committee, which is chaired by our facilitator today, Ms. Derelyn James. So thank you very much to that team that organized this stakeholder engagement. And it has been a success because of that, but also because of all of us who participated in it. Thank you to the host. You've done well, ma'am. Thank you so much for facilitating this session. Thank you to all the speakers from the GC chairperson and the other chairpersons of committees who were panel leaders, from various committees of the CDA, the panelists themselves. Thank you so much to all of you. You are our strategic partners. We are starting this work with you, and we will work with you for the next 5 years. Up until we conclude our work, we review the National Drug Master Plan together, but also importantly, we implement it together. We monitor and evaluate it together. Thank you so much for all the inputs you have made in those panels. You've really made our work very easy going forward. But thank you to everyone else, the participants who were not necessarily presenting any input, who actually posted their ideas on the chat group. We will definitely make use of that. We really would have appreciated an input from the security cluster, and we take their suggestion that perhaps going forward, we should look at a much more secured platform. But we thought that, we actually thought and believed that this was the webinar is a more secured platform. And I'm sure the host can indicate to us that we did not have any what do you call it, any people who were not invited being part of this. But we are interested to listen to our security cluster, the SAPS in particular, and also because we are interested to see the policy shift in terms of how we all understand the challenge of addiction and how we are responding to it, because the National Drug Master Plan is clear to say that we need to shift from a punitive approach into a much more integrated approach that looks into the health, that looks into the other development aspects of the users of drugs. So thank you very, very much. We really appreciate this session. And I would like to declare this stakeholder engagement session officially closed. Go well, you're not traveling, okay? But enjoy the rest of the day. Thank you very, very much.